Christ. Oh, wrong buttons. Subathon, Subwave, no. Oops. It. Ba-doo-ba-doo, ba-doo-ba-doo, ba-doo-ba-doo-ba-doo. Something that's not gonna get me in trouble on the life. Doo-ba-doo, ba-doo-ba-doo-ba-doo. Alright, that'll work for now. Ha! Thank you, Hannah. I think I'm funny sometimes. But we're getting set up right now. We still got another about 10 minutes that I'm getting set up for. I got all of my research up, ready. Hannah, no! If that happens, I'm gonna cry. Actually, no, I won't. I'm gonna make another one whether they like it or not. What do you do if you have a rabbit that's overweight? I cut back their food, and if need be, take them off pellets and throw them on hay. Preferably grass hay if they're too overweight, because the alfalfa has too many calories. But the idea is moderation in pellets and feeding them appropriately. That's what I do. Is everyone able to hear me okay? We debate with the vet tonight in about 10 minutes. They're supposed to come on. Hey, Julie. I'm supposed to make you a mod. Let's see here. Oh, no. Julie. Let me see here. Add moderator. Confirm. There we go. Hey, Becky and dogs. You could dye your hair. I'm still making you a mod for later, because I know I'm supposed to add you as mod, and y'all know I'm horrible about that. Also, look at this cup my best friend got me for my birthday. It says, "I'd punch a bitch for you," in the throat. And, it is just class A. Ooh, that's when you need to go onto our Facebook group and share. If you have cute babies, we have a Facebook group, the Itty Bitty Homestead Committee Collective. We all share baby photos there. Look at that. Fantastic. Sometimes you need an adult beverage. Hey, little blue coop, how you doing? Okay. And then you won't be accepted immediately just because I'm on here doing the thing. So, here we are. I got all my studies up. I have all of my notes. Look how beautiful my chicken scratch is in my favorite purple pen. We were up till about 11 last night. It hasn't started yet. We have another 9 minutes. I'm setting up. The Facebook group is the Itty Bitty Homestead Committee Collective. It's just a bunch of homesteaders. We talk about rabbits and all that. Now I want tequila, but I'd be at work at 5 a.m. Julie. Salute. Brilliant. Yes. Let's see. The 2-day-old mixes are looking so good. Such a relief after the shit. So yes. Oh my god, last year in babies was woo doggy. Let's see here. I'm gonna see add guests. Say I'm not viewers. Okay. Seeing. Bet I'm joining. Perfect. Would love it. Glorious. I'm waiting on for Domino to hop on. MMC probably is not going to be on for their own mental health. I have a 5-month-old buck that won't breed. He's a New Zealand black. What am I doing wrong? 5 months is still kind of young for some commercial breeds. Hey! There she is. Invite. Alright. Box. Alright. It's my mom!
Hello!
Hello! I'm getting set up. I have all of the studies. Right here, you see my computer.
Yay!
But I have everything up, and then I also took notes from our conversations last night about everything we talked about. So
Literally
I
could fill a
have,
book.
right, I shorthand everything though, so at least I know what the heck we're talking about. So, hey Becky.
Hey Becky, how you doing?
I say, I don't know if I showed you this yet, Domino, but my friend got me this cup, and I use it for my, it's my adult beverage cup. It says, I'd punch a bitch in the throat for you.
I love it.
But that was my birthday gift from her this year, and I'm like, you know what? That's gonna be my nightly beverage cup. But it's just apple juice in the cup. It's very great apple juice. I see this all the
Really,
time
really
with
good apple juice.
dogs.
A little hoppy.
A little hoppy, a little spicy. Let's see. I see this all the time with dogs, and I honestly don't get um the. So yeah, we're gonna talk about the great cart rabbit debate tonight.
And it's just, it's one of those things. It's different species, and you really can't compare the two.
You can't. Unfortunately, because if we could do interspecies where they all kind of lined up the same way, imagine how much easier research would be studies.
Right? Can you hear me?
Yeah, I can hear you. My headphone decided to disconnect there for a second.
I was wondering, I
Can you
heard
hear
the
me
little
okay?
glitch happen. Yeah, I can hear you good.
All right, perfect. I was gonna say, Doc says he'll be on in at 6 my time, so hopefully everything goes nice and smooth. I'm not sure if he's going to want to be as a dual host or if he's going to want to do guests, but once he gets on here, we'll figure that out.
Okay.
But other than that, do you have your rage ready?
You know it. You know it. What's your opinion on lionhead rabbits? I have one, and they're great, but you really need to know what you're doing.
The rage is ready, says Amanda.
Yeah, the rage is ready.
No, I'll tell you, Lionheads came on as a breed when I was in 4-H in high school. And it's taken a long time for me to warm up to them just because of how many problems they were for them to become a breed.
Yeah, it was a lot of infighting and stuff about that breed as they were coming up because there were so many mixes of other breeds into that breed. It was a problem.
I wonder how
You
they
actually count your rabbits, Julie?
I'd have to actually look on Everbreed to see how many I have right now. And I have two due today. So
Vesper's here. Woohoo! We got a mod in the room.
I say Vesp is here, Little Shit is here, Julie is here. So that's three mods in the house. So we'll see how that goes. Hopefully. Oop, I just disappeared there for a second. Hopefully we don't need many more mods, but I'm not necessarily expecting to need it. Hopefully.
These handcuffs are for us to be happy with it. What?
I don't know either.
I
So
missed
what are the rules for
something.
this live? Amanda asked what the rules are for this live. So the biggest thing, especially on our end, we're going to keep calm, cool, collective. It's going to be straight facts. We aren't doing emotions. The things for my mods and the comments, I want to see completely gone. We don't deal with bigotry. We don't deal with sexism, racism, those kind of things. And just blatant rudeness, just block.
Yeah, and we know that the subject matter is pretty touchy for a lot of rabbit folks.
Hmm.
Please keep calm.
Yes. We want nice, calm, cool, collective arguments. You can ask questions, and you don't have to agree with anything either side is saying. We just want to stay professional and respectful because this is one of those debates where we just want to keep a nice, even keel.
I really wouldn't cross a Holland and an English spot. The breeds, number one, there's too much of a difference between the structure on those. And if you did a male English spot to a Holland, you might end up actually killing the Holland in the process. It's too much bigger.
Mm-hmm. All right. Let's see. But I'm trying to see how I can send out this request. Suggested. Leave it to me to not know how TikTok works half the time.
Oh, hi! So we got Liberty Tree in here.
I love Liberty Tree. Let's see.
So do we. We have every color variation of the New Zealand as well.
I have no New Zealands. Let's see, Ghost. Crazy wandering soul. I'm looking through to see if he's in here yet or not.
Elephants with prosthetic limbs, I know. And same thing with horses with prosthetics and cattle with prosthetics. There's just some animals that aren't built for these things. Their weight or the way that they ambulate is just too... It just does not work with it.
Alright. Good. Switch.
Yay, blues.
Hey, look what I did.
I'm big now. Woohoo!
I did it as a grid because if I can't get it settled out, at least we'll all be the same size so we can argue at the same size. Or debate at the
Woohoo!
same size. It's 6 o'clock. Let me see if he's in yet.
I'm keeping my camera off, number one, to save you bandwidth, and number two, so that way if you have anything on the green screen behind you, that way people can focus.
Alright, sounds good. Alright. Are you in a barn? I'm not in a barn right now. I'm in my bedroom, just chilling.
Yeah, I was going to do mine from the barn, but I have better internet signal at the house.
Yeah. Alright, I'm gonna send out the link to Doc. Because it is 6 o'clock, which means we are on time for a debate.
Yay!
Yay! And like I told you earlier, Domino, I'm mostly here to mod, just
Mm-hmm.
because most of the time in these kind of debates, the first thing that comes out in bad faith arguments is just an appeal to authority. So,
Yeah.
and with my education background, it's employment and law, so I'm just
Yeah,
chilling.
yeah, exactly. That's why I included it on the bingo sheet.
I'm
Yeah,
telling you.
I included appeal to authority on there.
The amount of times I get a fallacy in debates with appeal to authority is just absolutely mind boggling. Because it has its place, don't get me wrong. But
Mm-hmm.
also, it's so easy to fall into the pit trap of, oh, you are an expert in the field, therefore you know everything and can't learn
Yeah.
anything else. And it can just guide people in the wrong direction.
It, sitting on your laurels.
Yeah. But I will say the biggest thing that I wanted to talk about when we do get Doc on here is the one, two, three, the fourth study he sent. That was the group study where it had a 45% morbidity rate when it came to chronic prognosis. That was the
Mm-hmm.
biggest one I wanted to talk about, just because most of the studies, like MMC pointed out, were included in that
Yeah,
conglomeration.
they took the other, so the retrospective actually took all the other ones and conglomerated them in.
Mm-hmm.
So, unfortunately, with the sources that he provided us with, he gave us the broken down ones that are already included in the retrospective.
Yes.
So, I think that we should focus on the retrospective because it already includes the data from the other ones. And if we want to extrapolate out, then we can jump on and look at specific details in the other ones.
Yeah. And the thing is the one thing, and it's not really an irritation standpoint, it's more of a me being petty and a bit of my pet peeve, is he actually sent just pages out of textbooks when it came to like the whole neurological and musculoskeletal diseases and the general principles of surgical techniques, which
Yes.
I understand from a certain perspective, but also when we're really looking into it, we can have theory down in these books, but when we're looking at outcome, I would rather see studies and studies that conglomerate anecdotes to show data than reading a textbook of theory.
Well, the other thing is that the surgical notes, it talks about technique. Uh, we're not arguing technique.
We're not.
Yeah,
And it's
we're not
again the
arguing technique.
question.
We're focusing more on the ethics of the procedure itself, not that the procedure that can be done, not that yeah, not that the procedure can be done, but rather should it be done.
Exactly. Like the can is always there. There's a lot of things you can do, especially if it's like the very like beginning of testing and trialing certain procedures. But just because you can, again, like you said, doesn't mean you should.
Who's got
All
the
right.
Jeopardy music?
He might just be running a couple minutes late, or maybe he's having trouble getting into the live. It happens sometimes. I
Yep.
did send it to him.
The doctor is running late, as usual.
You know what? I was normal.
The docs are
In
always running late.
They are like I love my equine vet, but he's always at least an hour late getting to the farm.
Shocker, right?
Right. And like I said, I love my equine vet dearly, but he always comes with hot coffee too.
Oh,
So you, oh, Doc is in.
oh, is he here?
Let me see here. Maybe we missed something. BSing.
I'm gonna get a trippy metal detector in here.
All right.
She's a BT too.
I love it. Bring her in.
I
Is
shared
Doc
it. I
in
don't know
here?
if she's gonna get here.
Yeah, no worries. If you have any of, oh, yep, there's Doc. Let's see. Working on it. Doc Trent is here. Give me a second. Let me see. Guests. Accept. There we go. He's here.
There we go. Hello.
Hey, Doc.
Hey, how's it going? I've been here for a bit, but just couldn't figure out how to get joined in your live, so
Get in
apologize
here.
for that.
I say
Yeah,
TikTok's weird sometimes.
yeah. So I'm gonna see if I can connect here with some video because I always like to have some resources
Legit.
to help
I say
out if I
I
can.
did the same thing. Oh, you can't see it. I did the same thing. I pulled up all the resources you sent me, and I have all of the notes from reading through those resources.
Yeah, good. I like to take notes while we
Now,
talk about stuff.
oh, heck yeah, I love it too. Now, before we do get started, I would love to, if you would just give your background, who you are, and kind of your credentials, and then Domino can give theirs as well.
Sure. So, my name is Trent Schrader. I am a veterinarian. So, I graduated from vet school in 2015. After I graduated from vet school in 2015, I did a specialty training, a year of postdoctoral training in zoo, exotic, and wildlife medicine at the University of Saskatchewan. Then I did an additional year of specialty training in zoological medicine at the Henry Dorley Zoo in Omaha. And then I was hired on as an associate veterinarian at the Henry Dorley Zoo. Was there for another few months to a year, but then I was offered a medical director position. So I was the medical director of the Lincoln Zoo and was there for 5 years. And then after that, I opened my own practice to see animals. So I'm a board. I have not sat for my boards yet. I'm not boarded yet. I think that's really important to clarify, but I'm board eligible in zoological medicine. And so, hopefully in the next fall or the following fall, I'll be able to sit for my board study. And so I own a veterinary practice in Omaha, Nebraska. I see basically about 80% exotics, 85% exotics, and then I'll see referral emergency care cases. And then I also am the assistant professor of zoo and wildlife medicine at Kansas State University at the vet college. And I basically am I teach students who are completing their final year of veterinary school on how to care for exotic animals and advanced medical techniques for exotic animals. And then I also publish research. So I look at research in zoo and exotic pets. One of the things that I currently am working on, for example, is an advanced imaging technique for looking at the tear ducts in rabbits and a new way to be able to image those. Part of my everyday work is working with rabbits and developing new techniques to be able to look at rabbits. So I split my time,
Legit.
basically. I, I own a practice where I see like between 30 to 40 rabbits a week for advanced medical care. And then I work the other half of the time, I work at Kansas State and see lots of referral cases from other veterinarians as far as getting advanced care for their animals. So,
Okay. Hi, I'm Domino. I don't do my legal name on social media just because doxing and all that other stuff. But I have a BA in animal sciences. I actually was invited out of high school to a high school that did concurrent college and high school credits at the same time for veterinary path people. I got a full ride scholarship to WSU Vet, but unfortunately, due to life circumstances, I wasn't able to complete. So I ended up just continuing being a vet tech. My specialty has been rabbits. I've been breeding and showing rabbits since 1992, so I have 30 years of rabbit experience. And it has been one of my mentors was the state zoological vet for Arizona State, and he was also one of my professors. So he is the one that gave me my ride to WSU. He really gave me an outstanding review there. And then after that, I just continued on working as a vet tech, and then most recently I worked under an exotics vet that had 40 years experience, and because of my health, I ended up with a heart condition. So I'm currently not working, but I had to quit because my health gave out, essentially. I worked until I broke. And so, but rabbits have been my passion. He still consults with me on the rabbits because he told me, he basically told me that I taught him more about rabbits than he learned in 10 years of conferences. So,
well, I'm sorry to hear about your health. I'd like to just point that out, and I hope that you're doing well. So,
yeah, I ended up with myocarditis from viral infection. I actually
mm.
got an infection from a parrot at work.
Oh. Mhm.
and it went to my heart.
Yeah. Well,
So
I hope you're feeling well.
yeah, but as far as that goes, with rabbits, rabbits have been my life. Literally from childhood, and my entire adult life has been with rabbits, around rabbits constantly. So that is my area of expertise. And Maddie?
Hi, I'm the moderator. I'm just the crazy rabbit lady that spends way too much time at rabbit shows. I'm working on my licensing for ARBA judge, and my education has nothing to do with rabbits, in that I have my bachelor's and my master's in human resources management and employment law. So I'm just here.
You're doing an important job. Thank you for doing it. So,
Yeah, I get to yell at people like you, Doc, that work too many hours.
yeah, always, for sure.
Okay, so
So,
where are we going to start? Yeah.
well, I think I just wanted to say a couple things first off. First of all, I'm on call, so I'm sorry if I have to go if I get called in.
Completely
But just
understandable.
so that you know. But as a second, I just wanted to briefly do a case review. So I have,
Mhm.
I think in all of these circumstances, at least when I'm teaching my students, we kind of go through a case from beginning to end. And so I just wanted to approach this maybe in a similar way.
Yeah, of
Uh,
course.
where we talk about like signalment and results of diagnostic testing and sorts of stuff like that. So basically, what we've got is a 2-year-old male neutered rabbit that has a history of congenital deformity of the rear of the pelvic limbs. So these owners had gone to, we were the fourth veterinarian that they had found. So they had found us on referral. The previous veterinarians had attempted to do palliative care techniques for them, but did not feel comfortable doing advanced surgical techniques to relieve some of the discomfort that this individual was having, and so had said that based on their comfort level, they were able to offer either euthanasia or pain management drugs. And this owner was open to euthanasia, but they wanted to see if there was someone out there who was willing to offer a surgical technique. And so we worked up the case to see if surgery would potentially be a good fit for this individual. So that included a subset of tests that were involved. So one of them is making sure there was no other significant concurrent diseases that were going on at the same time. So doing full body survey radiographs, so taking x-rays, the whole body, including the hips and legs, means doing blood work to make sure that there is no organ failure that's going on, no infections that are going on at the same time, and then making sure that the animal was a good temperament, like suitable temperament for advanced care. So making sure that it was calm under restraint, that it was an animal that would tolerate like oral supported care. So whether that's feeding or whether that's medications, and that he was a good temperament fit. So we took radiographs. At that time, what the radiographs showed was aplasia, or complete lack of development of the acetabulum, the hip joint, ball and socket joint. And so the component that did not form at all was the socket. So it's just a flat area. And then the actual head of the femur is not developed correctly. It's a stub, essentially. So there's no true contact between the hip joint and the leg at all. It's muscular attachment that's there. Now, we see things like that all the time. So that's actually the preferred method to fix hip disease in small breed dogs when they have hip disease. So you do a process called a femoral head ostectomy, where you remove the femoral head because the muscles there are substantial enough to make sure that it is a successful and mobile connection that's there. So anyway, so that's not there's no joint that's even present at the joint there. It's just a femur that goes to a not a acetabulum free hip location. So then we looked at whether or not, and then the stifle, the knees on both sides were basically a fused and severely arthritic stifle joints bilaterally. So, given that information and the rabbit's temperament, the ability to put the hips into appropriate conformation comfortably, we decided that the best route was to remove the diseased joint if we were going to move forward. And these sorts of situations, I think that it is incredibly important. The biggest thing is informed consent. The owner needs to know the likely outcomes that are there, but we have to have the idea of, if this doesn't go well, if he doesn't accommodate well to a cart, if he doesn't, if we're not able to achieve comfort for him, then we have to move to euthanasia, right? So it's a necessary second step, is that if the surgery does not relieve the symptoms that you're concerned about, we have to move to a euthanasia step. So it's called a comprehensive care plan, where we have a care plan that is step 1, 2, 3. So step 1 in this individual's case is, let's go to surgery. We'll remove the diseased joints. We'll allow that to heal. We'll give him a cart, and then we give him a time frame, a very strict time frame of 30 days, to see if he is going to be able to comfortably accommodate to the cart. And then if he's able to, and the owner's able to provide enough care at home, then great. And if he doesn't, then we've given a specific timeline and a specific deadline to make a quality of life decision at the end of that quality of life. So that's what we did. We did a bilateral proximal femoral leg amputation. He healed for that surgery very, very well. He's accommodating to his cart very, very well. He eats, drinks, moves around, sleeps, and so far is doing quite well. So so that was sort of the disease progress conversations that we have with the owner. We always make sure that we have the discussion about outcomes, so the owner knows that there's complication rates associated with this. Not every person is happy with the result of an amputation. Only about 90% of people our owners say that they're pleased with the outcome. So we tell them that there is about a 10% rate of people who are displeased with the outcomes of the surgery. We do tell them that there's a complication rate where you can have some some pain or some things like that. And if that happens, we can't manage it, that this needs to result in euthanasia. So we try and have those conversations on the front end so that there's no surprises for an owner on the back end.
Okay. So this rabbit, the rabbit that presented to you, has, in the breeder world, what we would consider, it's a form of genetic splay leg. And we would automatically nest box cull those. Those would not be allowed to live, essentially. We wouldn't allow them to exist.
That's probably best practice as a breeder. So I'll say that's probably best practice from a breeder standpoint, is to euthanize those animals at birth if you identify it.
Yeah. And so the problem in this lies not in the customer satisfaction. So, like in the information that you gave us, in fact, one of the retrospective that you sent us was something that I had already shared with our Hive Mind, our group collective, before. We've gone through it before. So on the question of the client satisfaction rate, unfortunately, we don't know how that question was posed or when it was posed. Especially if it was posed at the end of the study period after the animal had deceased. If you're grieving and you think that vet has done the absolute best that they can for your animal, you're going to be polite and say, oh, well, the vet did the best they could and I'm pleased with this procedure. So unfortunately, with the client satisfaction rate, we got to set it aside simply because of the emotional attachment and sort of people being polite post in the grieving period. So with that said, we want to focus more on I know that the surgery can be performed because I have seen them be performed. I've been in the OR assisting. So I've seen that they can be performed. That's not a question either. The question is, should it be done? And in the first place, should we get, should the option here, apparently, as you said, your client went to multiple different vets, and they were getting the no every time. And
So
there's a
I should point out that the veterinarians that declined them did not decline that they should pursue a cart. They said that their surgical skills were they weren't comfortable with the surgical skills necessary to do anesthesia and surgery on the rabbit appropriately, which is a different issue than saying that they didn't think it was ethical to do the surgery. It was a limitation in skill set rather than a limitation
towards you, they did not feel
in
comfortable.
ethical. Yeah, because they sent it to me. The reason they were sent to me from these other veterinarians is because they said you can get this surgery done. And I mean, if I didn't think a procedure was ethical, because I decline unethical procedures all the time. I don't like tail dock dogs. I don't remove, I don't do ear cropping. I don't do like cosmetic surgical
Declaw
procedures.
cats.
I don't declaw cats, right? So cosmetic surgical procedures I don't do because I don't think they're ethical. And if somebody wants them done, I don't refer them anywhere because I say it's not an ethical procedure, right? So if I'm referring someone to another veterinarian to have a procedure done, we do that because we believe that another veterinarian can do the procedure, but it's not within our skill set. So I do that all the time for fracture repairs and orthopedic things like that I'm not comfortable with. But I wouldn't send the person to have a second unethical procedure done. So anyway, continue.
Now having gone through the resources, the outcomes that we're seeing in the resources are a great amount of, they'll live through the procedure, but then you end up with a mass of sorry, I'm losing my train of thought here. You're ending up with a mass of complications post-surgical that they can be managed, of course, but at the expense of what? This rabbit is sitting there. The rabbit is a prey animal, and so it can't show this. And clients, of course, will go home with education on, what to look for in a rabbit that's in pain and stuff like that. But a lot of them don't compute that. And my evidence for that is I would like you to take some time and go into Facebook and Instagram and look at groups specifically on disabled rabbits. There's a tripod rabbits group. There is a culture around these amputated rabbits, okay? And it is a mindset of save it at all costs. And they doctor shop from vet to vet to vet until they get a yes.
Sure.
And so, unfortunately, the other thing is that the rabbit is showing clear signs of pain, squinting eyes, staying in one location, going off feed generally, going into GI stasis because they're going anorexic. They're showing all the signs that they are not right. And these people will keep pushing them and keep pushing them and keep pushing them. And when you have this set of complications combined with this culture that has evolved around these rabbits, it can end up to where the client is reporting to you the rabbit is fine, but then they go on Facebook and they tell everybody the rabbit is not fine. They show all these pictures where the rabbit is not doing well. And then they'll call back in constantly going, okay, well, I don't know what's going on. I don't know what's going on. Why is this okay? Is this okay? So it's a combination of these things that doing the procedure in the first place is going to end up with the rabbit living through this cycle until it finally dies. And so in my purview, it's not ethical to do that procedure in the first place because the rabbit's going to end up as part of this cycle. Oh, Maddie.
And can I note, along with the anecdotal evidence that you provided, Doc, you also provided me a study of rabbit outcomes after limb amputation, where out of the 34 patient studies, 85% of 29 rabbits had acute or chronic morbidity, and in that 59% had difficulties in ambulating and grooming. And I know there is the argument for this was a smaller rabbit, therefore there's going to be a greater success, or at least that's where I think your mind is going. Um,
It's
so
one of
with
many
these
factors. Yeah.
yeah. So
Yeah.
with that fact taken in place, with the data of being, 85% morbidity, and I know that there is a range, but
Mm.
a lot of those ranges, a lot of them are death on table. They are death right after. They're death within the first 12 weeks. What is it between the anecdote and these studies that you saw where you would say, hey, uh, looking at the evidence, we can do this successfully. The rabbit's not going to be in pain, and therefore, this is going to be an ethical practice for longevity of quality of life.
Those are great questions, and you brought up a lot of good points. So, so I was trying to take notes, and if I missed something that you said along the way that you want me to get back to, I will absolutely do that. I'll say, first of all, the one thing that we have to deal with, the one question that is a huge one that we answer, because you brought up whether or not survey data is accurate or not. Are these owners relaying information that is real, or is it not real? And one of the tenets of research and the tenets of the survey data science is we only have data in one way, right? So I can't make assumptions about people's intentions or things along those lines. And so we try and control for that. We try and ask the question in multiple different ways on these surveys to try and kind of tease those things apart. But sort of you have to trust people to some degree to answer truthfully, at least whether they're happy or not. I don't, and I shouldn't say I don't just trust people. I in general don't trust people. But as a general rule, when it comes to like looking at survey data, if there was alternative data that existed that said, hey, this percentage of people lied to you, then that's important for me to know, but I don't have that. What I have is the survey data that's in front of me that says that 90% of people are happy. So I kind of have to work off of that and try and make as few assumptions as possible. Like what percentage of those people aren't happy and wanted to be nice, I don't know. So it's hard to say. The segue from that and I think this is really what the crux of the main uh, ethical conversation comes down to is, does the ability to do the surgery mean that you should do the surgery? And then when that surgery goes home, are the outcomes at home fair for the rabbit? And it's not just that they leave the hospital in good shape, that they stay at home in good shape for an extended period of time, right? Is that,
Correct.
yeah.
Absolutely. That is where
So,
we are at.
okay. So should the surgery be done? I would say that as a general rule, I don't believe in a multi-tiered system of medical care for different species. And so, for example, if in a dog you would say that a knee was severely damaged, and I'll get to the very obvious argument that a dog and a rabbit are not the same. Like I completely understand that and should have different approaches applied to that. But in general, if you have a plan for a dog with a knee problem, then you should have a plan for a rabbit with a knee problem, right? And similarly, if it's a horse, if it is a turtle, if it is whatever, you should attempt to come up with a management plan that's there. And if your management plan is euthanasia, then at that point, you sort of have two routes to go down. You can either give up and say, like, yeah, this animal can't have advanced medical care, period. This animal is not able to tolerate advanced medical care. Or you say, let's approach this in a different way. Let's modify in a different way to try and make advanced medical care amenable to this individual, to try and bridge the gap. That's how we start to move forward. I feel like that's how we start to move forward in a medical standpoint, is to say, we have an inadequacy. We have an animal that's not receiving the same standard of care as other species that are out there. How do we match that inadequacy and make it better? So for rabbits in general, there's a huge different temperament, and you've experienced this. I'm sure you've experienced this. Whereas there's some that are super flighty, there's some that are much more amenable to handling. There's significantly different personalities that come with that, and so that is the number one factor that goes into deciding, is this animal going to be amenable to a cart? Is it very personable? Is it one that is going to allow people afterwards to be able to take care of it? And this individual did have a good personality. Now, there are other factors that go into it. Small body size does make it more likely to be successful. A thick fur coat, having a species with a thicker fur coat makes it so that they're more likely to be comfortable in a car and comfortable in a sling. Like, some of those considerations come into it as well. But in general, temperament has to be number one. So, and sorry, you had a lot of good points. So I'm circling to them, and I'm trying to stay in a coherent order here. But there's always the risk. And Domino, I think that your point is very, very interesting, is there are limitations to the client's skills in interpreting rabbit pain. And that's where, in interpreting rabbit sociology. And that's where a lot of the problem comes in. And I consider that a failure on those vets' part. So if you have a client that goes home and you haven't taught them how to look at pain and when the stop and start signs are for when that animal isn't doing well, then you failed as a veterinarian. And if this rabbit ends up on the internet in 2 months and is looking really crummy, and somebody says, hey, this rabbit's in pain, it's anorexic, and all of those good things, you mentioned so many good things that are ways that we can absolutely know whether a rabbit is stressed. We can absolutely know whether they're in pain. We have the skills to do that. We have the tests to know that. And so if I know those things and my client goes home and doesn't know those things and doesn't know how to put those things into practice, that's a failure on my part. And so part of it is client selection too. Knowing that the client that you're working with is intelligent enough to be able to look at those animals and know if they're in pain, is going to take the steps to care for them at home that they need to do. And then also to make sure that they are going to come back either to myself, or I'm not the primary care vet for most of these. They go back to whichever vet sent them to me. So I'm there mostly to provide advanced medical procedures and medical services. But to make sure that that vet that they go back to also has the skills that they need to be able to give them some care. So that's the subset of skills that I think is important as a vet to give an owner. So it's not just about doing the surgery and walking away from it. I have a responsibility to teach in that situation, and I have to teach them how to do a good job. So what you described. Oh, go ahead.
Oh, a couple of little things here. So when you're making your selection criteria on the rabbits based on their personality, are they coming to you a drug-free?
Yes. Yep. Drug-free. Mm-hmm.
Okay. I just want to make sure, because that can impair their ability to express that personality. So I want to make sure that they're coming to you drug-free.
Yeah.
The other thing is oh, dang it. I lost the thought again. When you're saying that you're selecting your clients, can you elaborate more on that? What in a client tells you that they're going to do a good job?
So there's a few things. So there are some clients that would come in where I would not find them to be a good fit. Number one, if they aren't able to adhere to a care schedule. So if their time at home isn't sufficient to be able to follow the animal's care schedule, which we write out and is pretty strict, that's not a good fit. They have to be available to be able to do physical therapy with the individual 4 times a day. They have to be able to administer medications on time. They have to be skilled enough to administer medications in that immediate post-op period, so in the first 2 weeks afterwards while they're receiving medications. So those kinds of things they have to be able to do. The other thing they have to be able to do is, if I go over a grimace scale and I describe the grimace scale and then I take it away from them and I say, okay, what if these are the signs of your rabbit showing? They have to be able to tell me correctly where they fall on a grimace scale. They have to be able to say, yeah, he's squinting his eyes, he is having bruxism, he's grinding his teeth, he has a hunched posture. I know that those things make it so that he's a grade 3 on a grimace scale, and they have to be able to repeat the information to me that I have been providing to them, so to show that they're listening and that they're learning and that they are perceptive enough to pick up on those kinds of things. So those are sort of from a client learning standpoint, they have to show me that skill set before I would agree to do a surgery.
I would personally request from the client actual pictures of the rabbit at different times a day.
Yeah, and
to
they are required to do follow-ups as well. So they have a follow-up schedule that's part of their care plan. So the rabbit gets seen every 3 days post-op for 2 weeks. And then
mhm.
after it's seen every 3 days post-op for 2 weeks, then it goes to a once-a-week schedule. Oh, sorry, go ahead, Maddie. I didn't mean to.
Oh, no, no, you're good. I do have a question when it comes to your patient selection on post op, especially
Mhm.
with the rabbit that you showed that initially after post op, he's on 3 different pain medications from my
Oh,
Yeah.
you cut out. You
Oh,
cut
sorry, you
out.
cut out.
Sorry about that. Can you hear me now?
Yeah, so
Yes.
you had said that he's on
All right.
3 medications post-op. That's what we heard.
Yeah, he's on 3 medications post op, and one of the
Mhm.
biggest things we look at rabbits is things like GI stasis, bloat, a blockage just in general of gut movement. How do you look at that when it comes to clientele to explain to them both pre op and like expect it for post op should it happen?
Yeah, with the narcotics slowing down GI.
Yeah, so that's super important. And so the that comes down to appropriate medication selection and understanding the balance of things. So there are a difference in, and this gets a little complicated. And so if there's any questions like about what I'm saying, just please ask. But so there are several different type of opiate receptors that are in different locations of the body, right? So you have kappa opiate receptors, you have delta opiate receptors, and you have your primary one, which is your mu opiate receptors, okay?
Mm-hmm.
And mu opiate receptors are located in the GI tract and can slow gut motility. But if you use a mixed and what we see, and that's variable depending on which mu agonist that you're using as well. So you can see a little bit of decreased gut motility with certain medications. So like morphine, sometimes we'll see some decreased gut motility and things like that. But with things like hydromorphone, it actually stays really well. And so we use hydromorphone constantly in GI stasis rabbits because GI stasis is far more commonly associated with pain than it is with drug use. And so pain causing ileus, what happens is
Mm-hmm.
when they feel something painful, it activates their HPA axis, so their hypothalamic pituitary adrenal axis, right? And so when
Yes.
that's activated, they go into a fight or flight mode. And so what you've probably heard, the phrase is rest and digest versus fight and flight. Those are the two things
Mm-hmm.
that happen, right? And so if that HPA axis is activated by pain, you go into the fight or flight mode, and then that makes it so you're not resting and digesting. So by providing adequate pain control, you shift that animal into a parasympathetic tone or a relaxed tone where they can digest and can increase gut motility. And so we manage that with a combination of IV lidocaine combined with IV hydromorphone. We also, when they go home on buprenorphine, which is a mixed mu agonist, so that we're covering more of those mu opiate receptors and provide pain management. We usually have them measure stool output as one of the indicators of whether or not they're having some GI stasis. We also have them measure the amount of food going in. So it's a pretty strict protocol that's there, and that's important because you can have people that aren't going to have that level of follow-up, and then you do get into that cycle where if you have an owner that's not willing to put in the work, and if you have an owner that's not educated enough on the topic, they can really have some unfortunate outcomes for these bunnies, and that's not fair to the rabbit, you know. So
Yeah, we all know that that a unicorn is a client that is 100% compliant.
yeah, exactly. And that's who I try to recruit, right? That's who we all want. So that's why
Yeah.
we're pretty strict as far as who gets the surgeries, and so that's why we end up as a referral institution, and that's why we end up with people bringing their stuff to us as like the second or third or fourth veterinarian, is because we provide procedures that are pretty advanced in a lot of circumstances. So yeah.
Yeah. So another thing that we see in these rabbits, dehiscence at the surgical
Mhm.
site,
Yep.
and then when they're in the carts specifically, because of a lot of times the rabbit's going to lean down
Mhm.
in the cart, sediment. I know that rabbits are built, by Harcourt Brown 2010
Mhm.
did a speech at the World Veterinary Congress on calcium and urinary issues, basically.
Mhm.
rabbits are built to express sediment. So when when they have that pelvic tilt in the cart, that sediment is running to the fundus of the bladder, and so it's just sitting there and building up and building up and building up, and so you end up with the bladder stones, kidney stones, back up into the renal pelvis. All of this, that is in which was it? Was it the retrospective, or which one where the rabbit was actually humanely destroyed because of the urinary issue?
It was
That
study
Felkin paper.
one with the 8-year-old mini rabbits.
Yep.
Okay, that was the 8-year-old mini rabbits. Okay, so in the cart, trying to get the cart low enough to the ground, especially for something as small as a Netherland dwarf, I would think that the post care with the Netherland would be frequent imaging of the bladder to make sure that you aren't having the sediment issue.
Yes, so that's a wonderful discussion of one of the common complications that we have. And so, yes, we worry about those things. One of the big ones that we deal with as far as the urinary stones is that those situations are about exactly what you talked about, which is appropriate cart fitting. And so to fit these guys for a cart, you have to get the sling low enough that they're in a normal anatomic position. And so that's one thing I take a lot of pride in that we do well, is that we can make specifically adapted accommodations that suit that rabbit's needs. And so I really think a lot of that comes down to, again, effort on the medical care provision side, that we're gonna fit them to a cart that meets their needs. And you are right on the money, though, that a lot of that comes down to appropriate fitting in the cart. Now, one of the elements of this bilateral amputation is that they do need to have physical therapy lifelong. And that part of that physical therapy is to be held upright to make sure that the owner is inspecting the bottom side of their body for urine scalding every day, and is inspecting any sore spots every single day. And so that physical therapy every day, when they pick them up to evaluate and make sure that there's nothing that's starting to develop, hair loss, urine scalding, any wounds or anything like that, that process also shifts the bladder so that they have sediment movement in the bladder every day, so that it
Going
prevents some
down
of
with
the
gravity.
exactly.
Gotcha.
So that's part of that physical therapy process to prevent that. But it absolutely is a huge medical concern, and it is an owner responsibility. And that's why you got to recruit the unicorns, right? You have to have that client that's going to be compliant. But I do require every month checkups with either your referring veterinarian or myself with these. And so that's how we usually do these.
Now, in my personal experience, the major thing I see with when you do a bilateral or even a unilateral rear leg amputation, you're getting a lot of stressors on those front legs, and you're seeing osteoarthritis in the shoulders and the cervical spine. You're seeing osteoarthritis in the elbows, wrist joints, toes, because it's a lot more weight there that shouldn't be there. Unilaterally, a lot of times I see scoliosis from the rabbit shifting its weight. In fact, I was just looking at one of the disabled rabbit groups on Facebook today, and there's a Flemish giant with a massive scoliosis in its spine now after a unilateral hip amputation at the hip. And so
Absolutely.
the thing is even with proper cart fitting, there's still a lot of weight there, and there's what we've seen in the studies and what I've seen in personal practice is that the arthritis sets in really fast, like within a year to 2 years. And so that becomes another pain factor.
Sure.
And with pain medications, we know they have a certain lifespan, a certain time frame that they work, and as they start to wear off, there's those windows between doses. I know this is going to fall into, we have to know how to appropriately dose when we know the animal is actually hurting. But the thing is with rabbits, they don't show it, so frequently you see it later than sooner. So with this, at what point do you say, okay, is this how do I phrase this? If we know that this is going to be a problem going on, and we know that pain causes GI stasis,
Mhm.
and we know that there's going to be some gaps in between pain control that might lead to the GI stasis,
Mhm.
is it fair to the animal to proceed with that when we know that that's a possibility?
It's a really good question. Maddie, you had your hand up, so I just wanted to make sure I didn't miss you.
No, you're good. I was just wanting to concise it, and she got it like down to the point, so you're good.
Oh, sure, yeah. So I think you make a really good point. So you have a risk post-op that you are, and tell me if I'm not hitting on your point specifically. But you have a risk in post-op pain management that you have a gap in coverage, right? And so it is really important to make sure that your pain management plan is on a strict schedule. And so we have pharmacokinetic studies and pharmacodynamic studies that show exactly how long those drugs are at therapeutic levels in the bloodstream. So there have been studies that are done. We administer meloxicam to this rabbit, test their bloodstream. How long is meloxicam present in their bloodstream at a level that has a therapeutic level of anti-inflammatory control, right? And we know that number is about 26 hours. So we dose every 24 hours to make sure we don't have any gaps, right? And similar with buprenorphine, similar with hydromorphone, similar with gabapentin. There was recently a study done, and this is what's wonderful about medicine is we're always getting better at this. There was recently a study done in rabbits that looked at gabapentin as a pain control drug and found that we needed to move up from our old dosing at 11 mg per kg to 25 mg per kg in gabapentin dosing. So now we have gabapentin, and that 11 mg per kg dose was based, or 11 to 15, but a lot of people did 11 back in the day. Anyway, back in the old days. But we moved to 25 now because we have that data. So it's about using the tools and using the research that's out there appropriately to make sure that they're getting the medical coverage.
It's just like with the antihistamines in dogs, that they have a much higher window than recently
Exactly.
thought. They have
Exactly.
they can actually be super dosed that we don't really know. Let's see, what was it? So yes, even with the window, we know the blood serum windows. But I am a human that has had my entire spine redone. I've
Yeah.
had my shoulder redone. I know for a fact, being a human that's had multiple surgeries, that what we see on paper for a medication, and this is one of my strengths was pharmacokinetics and was drugs and their applications. So what we see on the windows and the testing, a lot of times it varies very greatly from individual to individual. You might have super processors, you might not have a super processor. They're going more into the genetics now on those animals that can process those medications quicker. I was with the MDR1 gene in dogs. I was going to WSU when they were doing that.
Mm-hmm. Yeah.
So there's different genetic differences in these rabbits that might mean that they burn through the medication faster, or they might go through it slower, which on either end of that, if they burn through it faster, then they end up with a longer pain window, and if they go through it slower, then you might slow down the GI tract too much.
Yeah.
So
I think it's, oh, sorry, not to interrupt. I was just,
no,
before we lose the train on that. So that's why in my clinical experience, so in the rabbits that I manage with these pain syndromes, this is a really good point. So over time, arthritis develops. That is inevitable, and yes, it's true. You are going to get some degree of arthritis in the front legs. Now, that development of arthritis, it doesn't have to be severe. You can restrict it to minor development of arthritis, and you can have it happen very slowly and far enough in the future that animal lives to a normal lifespan before it becomes an impairment on its quality of life. So the goal is to get them to that point. And then you raised the perfect question to follow that up with is, how do we know though that they're not suffering? And that's why these pain scoring systems that are in place are so important to follow. And so the Grimace scale is a huge one. We have to understand the Grimace scale. I also think that the feed intake and feed production, or the stool production scale, are really, really important. So we have to measure how much food they're eating. We have to measure how much stool they're producing and make sure that they're in line with their preoperative standard, right? And we have to make sure that they're in line with average standards. So I wanted to pull up a reference for you if you haven't seen it before, and it's one that I didn't know I needed. And I don't have a small PDF for this, but maybe we can share it over something that's not email, so I can give it to you.
Okay.
But there is I want to make sure that I quote the author correctly so I give them appropriate credit. So it's Rabbit Feeding and Nutrition by Cheeke, Cheeke. And they discuss in that textbook pretty significantly the feed input and output and fecal output associated with disease in rabbits. And they talk
I think
about
we already
how...
have that one at Bun Club Wiki.
Okay, that's great. Yeah, so
we might under the feed. I'm so sorry. Under the feed and nutrition studies. So we are part of a group called Bun Club.
Mm-hmm.
And for the past 3 years, we have been collecting, cataloging, and grabbing every single rabbit study from across the globe and trying to categorize it into a searchable wiki.
Sure. Oh, that's wonderful.
So,
yeah, that's great stuff.
I believe the Cheeke study is under Feed and Nutrition in the Bun Club wiki.
Yeah.
So if you go to the research link dump and then go to Feed and Nutrition, I think the Cheeke study's there.
Good. Yeah. So it's a whole textbook. It's a whole textbook for that one. And then there's another one that's called Nutrition of the Rabbit by Blass and Weissman that I also recommend. And so those are two really, really good ones. So then, when it comes to the Amanda, who was in there was a really, really wonderful question that was pain, and they have pain, and how do you understand, or how do you know in these prey species whether the pain that they're showing, what if they don't show any symptoms of pain at all? And that's the thing, that's the super important part of reviewing the literature and understanding the science behind it, is that we have evaluated rabbits and inflicted. So in a research setting, they have inflicted these small wounds in various degrees of injury and seen how the rabbits respond to them, so that we can understand the signs of pain they show with varying degrees of injury. So one of the things that they do is they do thermal injury, and I obviously don't, it's helpful information to have out there. I obviously don't want any rabbits to get burnt, but the way they do these studies is they'll do small burns like on the feet, or inflict an infection in the bottom of the foot, and then say like, okay, this is a minor source of discomfort. Hypothetically, in a person, if you had a small burn, it would be not a huge source of pain, but would be an issue. And then they look at the physiologic changes that are associated with that. So feed intake, activity level. They look at the amount of stool produced. They look at borborygmi, so the total amount of movement of the GI tract. They look at Grimace scale scores. We look at equal weight bearing. Cortisol levels. Oh, you can. So I've actually published. You're getting me excited about topics now, because I've actually published about stress physiology. I taught in a stress physiology lab and how to evaluate stress, and looking at things about like comprehensive health scoring. So there's these comprehensive health scoring. Cortisol is such a cool drug, such a cool hormone, because the thing with cortisol is that you change it by measuring it, right? So when you hold a rabbit to draw blood from it, their cortisol goes up. And so those numbers, when we use them in awake rabbits, are almost all artificially elevated a little bit. But we have these other things that we can test, like fecal cortisol levels, that are a better approximation. Oh, sorry, go ahead. I got excited about the topic. Go ahead.
Oh, no. I'm right there with you, because Yes. Okay, so with the fecal cortisol, you brought it up initially, but I wanted to jump on it while it's fresh here. So the fecal cortisol collection technique, unfortunately, because of it. Okay, number one? Do you have the rabbit isolated? Number two, cortisol varies throughout the day naturally, and so
sucks. It's a terrible measure of stress.
Okay, so it varies naturally throughout the day anyway. So with fecal testing, with the fecal cortisol testing, unfortunately, I don't really trust the fecal version. I trust the blood version, but the thing is that recent research has pretty much destroyed and thrown out. In 2020, there was another study that came out where the previous studies on tonic immobility flipping the rabbit over.
Mhm.
Okay. The one that everybody hangs their hat on is one from the 1970s, where they literally inverted the rabbits and slammed them into a metal trough to get the reaction. In Poland, a vet clinic in Poland actually did a study in 2020 on all their patients coming in. They were doing cortisol levels in and out on half the group. The other half of the group was in an upright position. It completely blew these previous studies on TI out of the water.
Okay.
It was a complete inversion of what everybody thought. Their glucose went down, their cortisol went down. They were much calmer in the TI position. The heart rates were lower. They were generally in a much calmer state upside down versus having the procedure done in the upright position. And I noticed that
Yeah.
in one of your TikTok videos, there was a rabbit on the table. I think it was when you were talking about the coat types, which I would like to amend with you because rabbit breeder, we know rabbit coats very well.
Sure.
But with the rabbit that you had on the table where you were discussing the coat, I think that was a Hololop. I noticed that the respiratory rate on that rabbit was sky high. I could see that rabbit's heart pounding out of its chest in the upright position on the table.
Sure.
And so,
I think so. You're talking about the one where I said don't shave the foot, right? Is that the one you're talking about?
No, it was how soft the coat is.
I'll be honest, I don't remember it.
Describing the different levels of the fur, and you were talking.
You were describing the different types of fur.
Yeah. So you have the wool coat versus the guard coat, and then whether or not, depending on the breed, you have different heights of the wool coat versus the guard coat, and why Rex rabbits have softer fur.
Yeah, I was actually watching the rabbit's respiratory rate during that, and it was just absolutely stressed badly.
Yeah.
It was frozen, and it was upright position. It was absolutely frozen. Its heart's pounding out of its chest, and its respiratory rate was just nuts.
Sure.
And so, with us, we use the TI position, number one, to trim nails, number two, for all the body checks, feet checks, vent checks, all of that. We do that on a regular basis. We have never had an issue.
Sure.
So with breeders, we frequently get flack back from the pet community about turning rabbits over. But now the newer research is starting to show what we have always done intuitively, and what we've always known intuitively, the rabbits actually calm down. So if you were pulling, if you're pulling a blood sample off a marginal ear vein on a rabbit and that's in TI that's already calm, and you're getting a spike in cortisol, then I think that would be a better method of collection of the cortisol, because then you'd get a true result versus fecal testing.
Got you. Okay. Sorry, I thought that was related to the amputation rabbit, but I understand where we're at now. And so yes. So yeah. Okay. Good discussion. So the reason.
I'm sorry. I know it's all over the place, but I had a point. I'm just trying to get back to it.
I know it's fine. I just lost track for a moment.
That study that you were quoting.
That was effects of tonic immobility. It's in the Bun Club wiki. Effects of tonic immobility.
Doc, do you want me to send that to you?
For me?
Yes.
Oh, I got it. I'm good.
You got it?
I pulled it up in my research logs here. I haven't read it before.
If you scroll down to the conclusion, they have it in pretty bold. They went back into the previous studies, and they're finding complete reverse.
Let's see here. Maybe that's not the same study then as the one I pulled up, because that wasn't their conclusion. But
it's under Bun Club wiki, Maddie.
So anyway, I'll talk about tonic immobility. I think that's fine. So tonic immobility is misunderstood, I think, in the medical community and the rabbit community in general, just because of the concerns with it and where our what's the terminology I want to use here? how it's used in different parts of the life, right? So the pet rabbit community is pretty against it. The breeding community is more less concerned with it as far as that goes. What it comes down to is time under immobility, right? So even as a part of a normal exam and as a part of evaluating a rabbit, we turn them the upright posture or like lean back posture when we do things. They can enter into a tonic immobility type of stance, even in outside of the normal, what we would call like a dorsal recumbency type of situation. So tonic immobility is a little bit of a more nebulous type of positioning thing than the strict like hold a rabbit on its back. That being said, the ill effects of tonic immobility are associated with duration of time on their back more so than it is associated with it happening at all. And so what happens is, again, that HPA axis, your hypothalamic pituitary adrenal axis, when you activate the HPA axis, you have an increase in the amount of sympathetic tone that happens. And so you have, and we missed this part of the fight or flight and those types of things, but you have fight or flight, and then you have the third F, which is faint, And so one of those characteristics that we worry about is that if you have a chronically activated or sustained activation of that HPA axis, that you're going to decrease gut motility and have post restraint concerns associated with moving them out of that rest and digest and into the sympathetic pathway that's there. And so by activating the activation of the sympathetic pathway basically is something that happens over time, though. It's not going to be something that happens from a 10-second, from a 20-second incident, right? And so when you're doing things like vent checking and feet checking and doing that sort of thing, it's not long enough to cause ill effects, right? So we don't really worry about it. Now, when you use tonic immobility for procedures, and that is when the old data comes into effect. So they used to use, and we obviously don't do this anymore because we have the benefit of sedatives and those types of things. What we used to do was to be able to do, stressful or harmful procedures on the rabbit that put them in tonic immobility. Yeah. And then they'd sit still through those vivisections and these really horrible things. And then afterwards you'd have all these complications associated with the activation of the HPA axis because they were on their backs for like 5 minutes at a time. They're having stressful stuff that was happening. And so then yeah, it's a problem. But if you're going to do it for 20 seconds to do whatever, you're not having them in there long enough to activate that stress hormone cascade that we have concerns about. Okay. But yeah, and so I understand. And so to get back to the cortisol in blood versus feces, cortisol is a terrible measure of stress as a general rule. And the reason for that is it is a single time point, short term, poorly liable hormone that it doesn't measure things very accurately. So the reason people like fecal hormones is because, number one, they're easier to collect. Let's be honest. It's easier to pick up poop than it is to draw blood. But also, number two, you have an average of stress hormone over a period of time that food is moving through the GI tract rather than a single time point sample from the blood draw. So that's why people have a preference for fecal over blood. But in general, it's just not a good tool. You need a comprehensive stress measurement. So if you're going to really measure stress, you need to look at DHEAS, so dehydroepiandrosterone sulfate. You need to look at that. You need to pair that with cortisol. You need to pair that with fructosamine. You need to pair that with body condition scoring and other things that look at some of the metabolic stressors that are going on. So stress is not a instantaneous thing, and we worry about chronic stress and the development of stress over time. That is measured with a scoring system that's bigger than a single blood draw or a single fecal sample, and needs to be measured over time. And that's why I really argue strongly against cortisol. And again, I taught in a stress physiology laboratory, so this is like my bread and butter. So this is, yeah.
And so with the stress issue with the rabbits, and like you said, there's a the same thing with the TI study. It didn't just do cortisol levels; it was doing the full workup. As far as stress was concerned, stress was measured. You had your heart rate, your physio, your heart rate, respiratory rate, your glucose, fructose, all of this. They were measuring that whole complex. But
Sorry, my
with
phone's just
the
dying, so I'm
main
grabbing my
thing, the
charger, but
main
I'm
thing is,
listening.
oh, you're good.
You're good though. I'm right here. I just am grabbing my phone charger. You're fine.
Oh, you're fine. Okay, so with the public perception of turning a rabbit over for checks, there has been a huge number of people, and we get attacked daily over turning a rabbit over to check its feet, to check its vent, to do grooming on the tummy, things like that. We get attacked daily. There is a horrible public perception about turning a rabbit over. And I in clinic, clients have literally attacked me over turning a rabbit over to check its nails.
Hmm.
So I
Yeah,
think that
and
should be a
that's a lack of
major education
education. That's
point.
hard. Yeah, totally agree. Yeah, that's a failure of education at many levels. But yeah, I agree with you. That's something where it's not fair to you either. It's not fair, and I disagree with this wholeheartedly. It's not fair that you are criticized for culling offspring that have health defects and things like that at birth. That's not fair. It's not fair that you are criticized for using brief periods of tonic immobility. I don't think that that's fair. It is not fair that you guys have like the burden of being the ones who have to breed these rabbits and then be told that you're making too many of them. That's not fair either, because you're trying to do good things for breeding and stuff like that. So I honestly think that your community of people who are breeding rabbits and caring for rabbits are treated really inappropriately in general. But that's one of those things where, as a community, we just need to educate, people to the best of our abilities. So, and it's a long
Yeah,
process.
somebody in the
Obviously, people
comment
don't
brings
like
up the.
vets either. So, yeah,
Oh well, yeah, I know. I work in
yeah,
that field. I know.
yeah,
I know the flack that the vets get.
yeah,
Somebody brings up in the comments, and this is a really big one. Is there's some rabbit education groups that have gotten their tentacles, I guess you could say, into the vet field.
sure, yeah,
House Rabbit Society being a real big one.
mhm,
The problem is that the diet that House Rabbit Society promotes wasn't based in science. It was okay. So I have to go into
I'm
background
not
here.
gonna. I'll be honest. I'm not familiar with the diet or
Okay,
the controversy at all. So you
the
have to
House
update me.
Rabbit Society diet is 80% hay,
Hmm.
basically sprinkling on pellets like it's a garnish on a donut,
Sure.
and about 4 cups of vegetables a day.
Okay.
So
Yeah, it's a
they're
lot. So is it okay if I address that? Because
yeah.
one of my first jobs was working in like nutrition development for rabbits. So from a nutritional standpoint, rabbit gut motility is directly related to the amount of fiber that's ingested. And so it's really important that they have a hay heavy diet just because of the density of the fiber components that are there. So there's a researcher, she's wonderful. Her name's Angela Lennox, that's looked at some of these gut motility movements and making and what diets are least likely to be associated with GI stasis development. Sorry, my phone's like falling over here because it doesn't want to sit
Hmm.
on my charger. But and when you look at that, that ratio of about 80% of long stem hays is really, really beneficial for maintaining good gut motility. And that's in that Blass and Wiseman book as well. The Blass and Wiseman book has a really good evaluation of nutrition that's there. From the pellet standpoint, pellets are a good supplement to it because you have irregularity in the quality of hay that you're getting. You have seasonal changes, like first cutting versus last cutting. You have differences in the taste and quality and texture, and so it helps encourage a steady diet. And it also makes sure to account for some of those mineral deficiencies. The downside is the size of the fiber length. So when they grind those pellets to a smaller size of molecule size. It basically makes it so that after they ingest it, you add water to that pellet. It breaks down by the mucus in their mouth and then the acid in their stomach, and then it can recongeal into basically one giant pellet. So you eat all these little pellets, and then it can basically recombine into one huge pellet, and it can cause gastric obstructions that lead to GI stasis. And so that's why the recommendation has been historically to do a small amount. So what I usually recommend is 1 tablespoon of pellets per pound of bunny. But that, I mean, you can adjust that, one way or the other. But usually a diet that
A
consists of
tablespoon
about
is about 1 ounce, right?
it depends on the density of the food you're giving, since the tablespoon is a volume measure and the weight is a weight measure. But it can be about that depending if they're like real dense pellets. Um, the pelleted diet, statistically speaking, has a higher rate of GI stasis associated with it than the hay diet does. But the pellet as a supplement is an important part of the diet. It just is. I'm trying to think of the correct percentages that were in the most recent Lennox study, because I want to make sure that I'm accurately representing it. What I have always recommended is 80% of long stem hay, 10% of the diet to be pellets, and then 10% of the diet to be greens. And that's to improve hydration. So like you mentioned before, they have a struggle with sedimentaria. So they have sediment in their urine. That's an issue. And so by increasing their hydration level, you increase the pass through of fluid through their bladder. And by increasing the pass through of fluid through their bladder, you decrease the sediment accumulation that can lead to urolithiasis, the stone formation in the bladder.
Okay, so I would like to counter this with 30 years of personal experience.
Yeah.
In the breeder world, GI stasis is a unicorn to us. And it's because we feed a rationed pellet. And most of us, I'm talking at least 80% of us, are hay-free. And the reason being, we feed 1 ounce per pound of ideal adult body weight. The condition scoring scale.
Oh, go ahead.
The condition scoring scales. We're basing this off of at least a 16% protein pellet, and we like to keep it between 18 to 23% fiber. Anything above that, they're in Merck Veterinary Manual. They have the International Table of Rabbit Nutrients. And once you get over the max threshold of about 25% fiber, you're pushing out, and there is a study on this, we'll grab it. But once you hit that max threshold of about 25% fiber, you're pushing out the nutrients faster than they can absorb. And so they end up pushing out, they unbalance themselves when you get too high in fiber. Your average Timothy hay, you're looking about 9% to 12% protein, DM, and you reduce that by about 3% for DE. So you end up underneath with that much hay in their diet. You're pushing over the fiber threshold, and then you're undercutting their protein. So what we see in pet rabbits constantly is brittle coats, constant shedding, lack of muscle condition, and it's sort of a slow, very slow, I'm trying to think of the word, slow deterioration.
It's a slow waste.
A slow waste in the pet rabbits.
Okay.
What happens is with the breeder rabbits, we do it with pellet, but we do it in a rationed manner. So a very strict ration manner, morning and evening, because they're crepuscular, they're going to eat morning and evening. We do 1 ounce per pound of ideal adult body weight. The problem that we see is with the veterinary body condition scores, we have physical evidence. We rescued some rabbits from a pretty bad situation. We had a doe who would have body scored, at the ideal range, but she died of starvation. And when she was necropsied, she was starved to the point that she had consumed all of the fat around her kidneys.
Well, that's not a very good
So
body
she,
scoring scale then if they have her having adequate body
but
scores
that's
for.
what that's when you go online and look up the rabbit body scales. She
Then
would have
those ones
hit.
are wrong. So I'm gonna briefly interrupt here. Sorry, just because
Yeah. Oh no, you're good.
on that specific point. So if there was a body scale score that showed that the rabbit could starve to death while being an appropriate body condition score, that body condition score scale that is published is wrong. It is just not followed with science, not backed by the research community. It's not backed by the veterinary community either. So there are very good body condition score scales that are out there that have looked at the ratio of retroperitoneal fat, so the fat around the kidneys, and associating that with peripheral fat stores, so that fat that is in the axilla, in the armpits, and in the legs. And so you can check and see when you do the ultrasound to correlate those to make sure that the internal fat stores and the external fat stores match each other. And so there are good body condition scores that are out there. And so the existence of bad scores does not mean that there is the lack of the existence of a good scoring scale. And I think that we've
What I'm
all
saying is,
experienced that, right? Where,
I'm
well,
sorry.
there's
I just
always,
want to. I want to bust in
yeah.
here.
Okay.
It is the most easily accessible, is what I'm saying. And
Sure.
so a client is going to go online. They're going to get this easily accessible information, even though they don't know it's right.
Yeah.
They're going to get this
Sorry.
easily accessible information, and they're going to make a bad judgment call. So their rabbit might be in a body wasting, and I'm trying. I still can't think of the word.
Cachexia is the word you're
Deficiency.
looking for.
They're in a nutritional deficiency. There we go. They start to lose their albumin goes down. Their protein levels start to drop. They start having issues with GI stasis. They start when you're getting the protein that high. You're including, and the other thing is with a lot of the vegetables, especially romaine lettuce. One leaf of romaine is equivalent to one medium strawberry carb-wise, and of course with rabbits, they can break down plant cellular walls a lot better than a human being can. So they can access
So,
a lot of those
sorry, say that
carbs.
one. Can you say that one more time? I just didn't understand exactly what you just said as far as like what was the carb ratio that was there?
Okay, it's one leaf of romaine lettuce from the outside of the head. That's one medium leaf of
Sure.
romaine lettuce from the outside of the head is equal carb-wise to a medium strawberry.
So I'm going to double check that because that doesn't reflect the information that I'm familiar with, but I could be wrong and I could have learned incorrectly, but
Yeah.
I'm just going to double check if you're okay with that.
Yeah, no, go ahead. I just go on Google and put in carbs in one leaf of romaine lettuce.
Okay. Gotcha. And then you were comparing that to which fruit?
A medium strawberry.
And
So,
also, oh, sorry.
oh, I was just going to say, so I just am comparing what is available on the U.S. Health and Nutrition website for
Mm-hmm.
and it looks like there's about a 3.5-fold difference based on their numbers that are there, that strawberries have about 3.5 times the amount of sugars and digestible carbohydrates that are present there. And so rabbits, as far as efficiency, absolutely, they are more efficient at digesting carbohydrates than we are as people. But because they are not foregut fermenters, right? So rabbits have an acidic stomach. They have a very acidic stomach. They actually have a significantly more acidic stomach than people do. And so they have a different carbohydrate metabolism than you would see in something like a cow, where they're able to digest carbs that we can't. Rabbits are sort of monogastric until you get to their cecum, and then they are able to mobilize the volatile fatty acids that come from their dietary intake in the cecum, and then that's where they get obviously most of their energy stores, which you're very familiar with. But in that type of situation, the easily accessible simple sugars that are found in fruits and in certain vegetables and things like that, when they are in carbohydrates, when they are in the small bowel, that's when we see GI dysbiosis, or a growth of inappropriate bacteria that develops there.
And that's the problem that I'm seeing with clients and owners in general.
Sure.
Is,
and I think that they overdo it. A lot of people,
dog
yeah.
bowls full of vegetables.
Yeah. And so I wanted to address another point, because you're right. People overdo it. We tell them to give 10% vegetables, and they'll give them a dog bowl of vegetables. Like, owner compliance, again, is like it's its own concern. I don't get to go into anybody's house and rap them on the knuckles every time they feed them the wrong amount of food. I wish I could. I'd go take some owners down and tell them to quit feeding so many fruits and veggies every day. But I'm not allowed to do that. But so the biggest thing when it comes to the nutritional deficiency associated with dietary intake. So I want to really highlight protein deficiency and fiber adequacy are not directly linked to each other. So you can have two things be true at once. You can have an appropriate amount of fiber and a deficient amount of protein, and at the same, and have other and have that both be true. So just by increasing the fiber, that doesn't mean that you have to decrease the protein level in that food at the same time. And that's one of the huge benefits, and that's one of the reasons that I recommend increasing the amount of pellets that they get by offering a tablespoon of pellets per pound of body weight for the rabbit, is that they are able to get the protein supplement from that for any deficiencies that are present in the diet component. So you can have an adequate protein diet. So supplementation with alfalfa is a higher protein hay source if your Timothy is low. There are other like protein supplements that are present that are ways to supplement a diet that also meets their nutritional needs from a fiber standpoint. Because if we remember about how they're natural feeders, they're forbers, right? So they eat a lot of grass, they eat a lot of fiber, but they also eat high density forbs that are out there, that are nutrient dense forbs when they graze better.
And that's the protein supplement, alone are 33% protein.
Right, and that's the protein supplement. So that's the pellet. So the forbs or the pellet, that's what you offer. That's the supplement that's there. The grass that forms the bulk of the fiber component that allows for normal gut motility, normal gut, the normal substrate for the bacteria to feed on. That's where we need to have the fiber, right? And so when we think about feeding rabbits, you're not really feeding a rabbit only. You're feeding a rabbit.
You're feeding their gut biome.
And the bugs that live there, right? And so by feeding the bugs that live there with hay is what breeds a population of bacteria in the cecum that is is going to have the longest longevity. So this is the question I wanted to ask about your GI stasis incidence. What's the average age of rabbit that you have in your breeding setup?
I've had rabbits that live to 12 years old, and
That's
hundreds
great.
of them.
That's great.
The average age, because we cull, you're looking maybe about 2 or 3, but that is specifically because we're culling out weaker individuals. And
I
so
can say
it lowers our average lifespan simply because we are being more selective. And a lot of us quit selling. A lot of the ethical breeders, we made sort of a conscientious decision between all of us to quit selling to the pet market about 10 years ago.
Sure.
And so we cull a lot heavier than we used to. So it's going to artificially change our numbers simply because we're selecting for the stronger, better animal.
Sure. And that's...
Hold on, Maddie had a point.
Oh, sorry, Maddie. Go ahead.
You're good. I'm going to say my bucks, when I'm looking at breeding bucks, they're being around alive 7 to 9 years normally, and that's for a commercial breed rabbit, for a larger breed rabbit. And then my does are breeding up to 5 to 6 years and can live up to 9, 10, 11 years if we keep them around. So that gives you an idea for a large breed rabbit.
No, that's great. And I think, so I'll say that the average presenting age at my clinic for a GI stasis rabbit is about 8. And so it is like sort of towards the high end of that. But and so the majority of GI stasis rabbits that we have come in have a confounding disease. GI stasis is not a primary disease in the vast majority of circumstances. It's associated with inappropriate supplementation, right? Somebody gives their rabbit a handful of fruits. It is inappropriate stress level. Somebody's got a dog that's barking at their rabbit that's in the house. You know, those types of things. The rabbit's in pain because they have like pododermatitis. They've got severe foot lesions that are there. So the GI stasis as a secondary disease process is really where we see most of those cases come up. And I think the fact that you don't see very many cases of GI stasis is wonderful. And I think that it's from the fact that you have a minimal amount of stress in most of your setups. You do a good job because you love your animals, you care about your animals. You do a good job of making sure that they're not in pain. You do a consistent diet that doesn't have these big fluctuations where one day I throw them a whole carrot and the next day they're on just hay and then they give them a handful of raspberries. Like, you don't see those things happen. And so,
we see that so much in the pet community. It just,
right.
it's
And those are
upsetting.
when I
With
see
our,
GI stasis rabbits. Yeah, yeah, exactly.
yeah.
So I would say that I think that the diet concerns are very valid, and it's something that I'm sure more people are looking into. But I would say that of the rabbits that I see that are consistently fed high compliance by owners, a good hay diet that has a relatively small pellet supplement and a small green supplement, those rabbits don't show up with GI stasis either, just like your pelleted primary diet rabbits don't show up with GI stasis either. And so I don't know that that is where we see the majority of that disease develop at. I think the majority of the time when we see that disease develop, that's in those circumstances where we have rabbits that are being inappropriately cared for. Yeah, go ahead,
Okay.
Maddie. Sorry.
So what I'm getting from this conversation, from pellet versus greens, or pellet versus a variety, is consistency is key when it comes to GI stasis, bloat, and all of those things, even as we get up in age, when it comes to any kind of rabbit. Is that what I'm hearing correctly as a layman?
100%. Yes.
Keeping stress low, keeping pain levels controlled. The other thing is, a lot of people don't realize that in the breeding and showing community, pododermatitis is actually a disqualifying feature, and so we get a lot of flack back about wire cages, but we keep those systems specifically because we do not get pododermatitis with the cages.
Sure.
I know it seems counterintuitive to what you've been told, but with the cages, the feet are drier, the toes can rest in a more natural position. Oh, what happened? I can't hear you, Maddie.
I think I hit a button. I'm so sorry. I was trying to answer someone's comment.
Oh boy, what happened? You paused him?
And, I didn't mean to, if that makes sense. I'm so sorry, Doc. I meant to answer somebody's question and I hit the wrong thing.
Oh no.
Oh no. Oh, Doc, no! We were having such a good conversation. Please come back. I'm so sorry. I didn't mean to hit that. No! I did not mean to hit. I'm so sorry. I meant to hit respond and my finger slipped. I'm so sorry.
Is he there?
Give me a second. I'm not sure.
Pododermatitis is sore hawks.
Yes, pododermatitis is sore hawks. Doc, that was such a good conversation. I'm so sorry. Let me see if I can get it back. I'm so sorry. I hit comment and it did something. I'm so sorry. I invited him back. The live has been broke, right? Gosh darn it, and it just got interesting.
He might have been called out.
Might have been, and if that's the case, I completely understand. I know he was on call. Oh, jeez.
Yeah, 0 cases of sore hawks on wire floor.
I hope he doesn't think that I, like, kicked him on purpose.
He was just about to answer.
He was, and it was such a good conversation. I love that conversation. It was so interesting.
Oh, Lord, it's not Maddie's fault. I think
I'm
he
so
said his
sorry.
phone, he was trying to find a charger for his phone. His phone might have died.
And I did send him the invite, and it is on the invite. I don't see him in the chats either. I say, Doc, where'd you go?
Just give it a minute.
We'll give it a minute, and like I said, and the thing is like, that was we're having such a good conversation, and I've enjoyed this live, because we don't have to all agree, and I don't necessarily still agree, but it was a good conversation.
Phone might have died. Yeah, I think he was getting
Yep.
up to run to get a charger or something because his phone died.
Say, Doc. No, not, okay, boo-boos. Yeah, you're okay, boo-boo. Oh, crap.
Yes, rabbits do have a show world like dogs. Ours is a little bit different, but we do have show world like dogs.
They do, yeah. We just had convention, like, not too long ago.
24,000 rabbits in one building in perfect condition without sorehawks.
They were, and I was so upset I couldn't get there. I was so upset.
Phone is evil. Yeah.
Oh, Doc, I don't know. God damn it, and he was having such great points, too. Go live together.
Oh, hey! Yay, he's
I'm
back!
so sorry, I hit a button. I'm so sorry, Doc.
Sorry. No, you're good. I'm not worried about it. My phone also was getting down to like 2% battery, so I repositioned so that I hopefully am not gonna have my phone die on me this time. So.
Okay, perfect, because
Yay!
we were getting into such a great conversation. I was so enjoying it.
Well, good. Yeah.
So, let me get back to where we were before everything went haywire. So in the rabbit breeding community, pododermatitis is actually a disqualifying feature. And so with our management systems, of course, with the wire cages, we get torn apart about them constantly. But we have them built the way that they are, which is a 16 gauge absolute minimum. We prefer 14 or 12 gauge galvanized after weld wire, which is really smooth on the foot. We 1/2 by 1 inch spacing at the max on the floor. So that way the foot can fall naturally. The toes can, go down. Just like if they were standing in dirt, the foot can lie naturally in its natural position. Whereas on a hard surface, wood surface, carpet, the toes, the tarsals get popped up and they put more pressure on that hind foot. So we keep them on the wire because they have a more natural foot position. The wire kind of has a bed spring effect where it will move with the foot. And the wire is also extremely dry, extremely clean because we scrub it constantly and everything falls through. So our management systems are designed to keep feet in really good condition. And I actually have videos of my rabbits just chilling in their cages. They've been in these cages their entire lives from birth to the moment that I took the video. Zero pododermatitis. And I don't understand why. There's thousands of us. We just had 24,000 rabbits at our National ARBA convention. Every single one of them is in perfect condition. 24,000 rabbits. Please explain to me how 24,000 rabbits can be in one building without any pododermatitis, in perfect show condition, and they all live in cages. And we are constantly being told the other.
Yeah, I'm not against wire cages. I raised rabbits. I used to raise breeder mini Rexes for years.
Oh, mini Rex. Okay.
Yeah. So I'm very familiar with like breeding rabbit setups, and there's nothing wrong with having them on wire. You just have to have an opportunity for them to get off of it. Is it all? So they need to have at least a what we call refuge space or refuge area where they can come in and change where the weight bearing is happening on their foot. And it doesn't have to be big. It has to be basically the size of the rabbit.
We do the slotted plastic resting boards.
Yeah.
That's what most of us do.
Then you don't need anything else. That's fine. I'm not against that. I think it's fine. you make a perfect point. They just need a rest mat that's there. We usually use like carpet like segments that were there for show purposes just because it looked nice. But yeah, really that's all it comes down to is and you make a great point. So one of the biggest causes that they have of these pododermatitis lesions is that they cannot get their toes into an appropriate standing position because they can't bury them into the ground if they're on a hard surface. And so what you end up with is flexor tendon tension that's on the bottom of the hock that's there, because as that tension's on the hock there, it causes avascular injury to the bottom of the hock or to the bottom of the ligament
when
that's
it
there.
when it rocks backwards. Yeah, when it rocks backward onto the heel.
Exactly.
Yeah.
So they just need a rest mat, and they as long as you are cleaning it regularly, they can have 80%, 90% of their cage be the wire floor. I don't have any problem with that. They just need a little rest mat. The only reason for the rest mat to need to be present is that rabbits do certain behaviors where they obviously take a foot off the floor, multiple feet off the floor. So they have times when they turn around to be able to feed. They have times when they are like for their cecotrophs. They have times when they're going to pick up a foot to groom underneath of it. And during those times, they're not equally, they're increasing the amount of weight that's being borne on the other 3 feet. And so during those time periods, then the wire can cause a little bit of pressure injury because it's smaller and they're not bearing their weight equally. So they just need those rest pads for those times during the day when they do those kinds of things, but otherwise they're fine.
Okay, so basically what we're doing is perfectly fine.
What they're doing is perfect. Yeah.
The only thing that I've seen with the resting mats is there's actually somebody, probably, I don't know, is Amanda still in the chat? She had a rabbit neuter itself with the resting mat. Its testicle went through the resting mat into the wire. The rabbit went forward, moved, and completely sliced open the testicle.
Yeah. Pick the right
so
mat. So that's a situation where, if you have equipment that fails, or if you have housing situations that fail, like stuff breaks down. It's one of those things where it's nobody's fault necessarily when something like that happens. Like if it's out of negligence, of course, but that's not what I suspect in this situation. It sounds like it was an unfortunate accident where there was an injury. I've seen lots of traumatic, what we call like scrotal trauma, where we have rabbits that bite each other's testicles open all the time. We see ones where we have little abscesses that form because they get a scratch or they get fly strike or they get something like that. We have I've done thousands of surgeries on bunnies that have scrotal injuries, and it's a very common thing. And that's one of the things. Go ahead.
Oh, I just want to touch one more thing. With solid resting platforms in cages, we see a lot of times that the rabbit, if it's a solid surface and you can't have urine drain out of it, tiles, wood platforms, beyond the bacteria sponge that becomes, but wood platforms, tiles, anything that's fabric, we notice that the rabbits tend to urinate on the solid surface, and they'll end up giving themselves sore hock from urine scald, just from the moisture contact. So it's preferable, in my opinion, to have a slotted resting mat, so that way you aren't having any kind of buildup of liquid that can lead to sore hocks from moisture contact.
Sure, or disposable. I have people that use cardboard and they throw it out every day, and that's fine too. Like if it's clean and it's sanitary and it's or slatted or whatever it might be, I'm fine with, like, when we use carpet squares, you throw them away every single day, and so that's fine. It's one of those things where you don't have a buildup of like a bacterial issue or anything like that because you're putting in the effort. That's an effort problem in my opinion, where you need to get the right tool.
You have to keep it clean.
Yeah, exactly. So I'm going to address. So I'm not trying to change subjects at all. I saw a comment that I think is not based in current understanding of rabbit sociology that was in the chat. that says that rabbits are not bonded animals, or that rabbits are not able to make relationships. And so we have pretty extensively studied rabbit stress levels when they are singly housed versus housed where they have at least visual contact with other animals. And so it's really in rabbits being housed in a solitary setting, rabbits where they don't have the opportunity to have socialization start to develop a higher frequency of immunosuppression, where they're very social animals, and so they start to get stressed. Their immunosupport goes down. So I just encourage everyone who's watching this to at least make them be able to see other rabbits, to be able to interact with other rabbits and engage with them, because it does make them more vulnerable to infections and to other diseases that we see come up when they're singly housed. And that's been shown pretty extensively and thoroughly in the literature with like over 1,000 animals. And that's particularly true in animals who are spayed or neutered, which we recommend in the pet trade because of the risk of cancer, specifically in female rabbits. The rates of uterine cancer in intact female rabbits is incredibly, incredibly high. And so, go ahead. Yep.
You nailed 3 things there that I really want to. Okay, so
Sure.
in the social nature of the European rabbit, it's a really recent study where it was a literature review.
Sure.
They
Hold
went
on, I'm going to grab my laptop because I moved and I don't have my laptop to look up the study you're talking about. So I'm just going to...
It's Maddie, what's the full name of that paper? It's The Social Nature of the European Rabbit.
Yeah, I'll get it in a second.
Okay. So in The Social Nature of the European Rabbit, Maddie's looking up the full title of it. It's a more recent study, a literature review. And it went through and it basically found that the studies where they were showing that the rabbits could tolerate each other socially in a group setting were rabbits that were under a certain age. And after you get into adulthood, over 6 months of age, then the rabbits were violently territorial, and they ended up in a, you have a dominant animal and a submissive animal, and one missed social cue ended up with the rabbits fighting, sometimes to the death, and maiming each other, etc. And we see this played out on the pet pages, on the pet groups. There's whole groups dedicated to rebonding the rabbits after they've tried to eviscerate each other or kill each other. Our management systems with the breeders, like with their stacking cages, with the way that our hutches are, our animals can see each other. They just can't physically touch each other.
Yeah.
So there is a world of difference between being able to see another animal versus actually in the enclosure and interacting with them, and that's what we're getting constantly is a huge pushback against our rabbits can see each other, they can interact with each other, through the wire, but they can't actually physically touch each other. These people are bent to the point where they will put rabbits on top of dryers to stress bond them, because it's so drilled into their head that they have to have these 2 rabbits together. There's one creator here on TikTok that has like 12 different rabbits. She threw them all together in a pen and wondered why they fought.
Yeah. So
it's
obviously
a cultural
stress bonding.
thing there.
Yeah. So obviously stress bonding is not something I would ever advocate for. The paper specifically that has kind of established this for like 30 years has been the gun paper. So there's a paper that's called I don't remember the exact title of it. Something about the behavior of single house rabbits versus the behavior of group house rabbits, and it's by a guy named.
Yes, we have it. We have it.
Yeah. It was in the early 90s, and just showed that single house rabbits have very common stereotypic behaviors, stress-related behavioral disorders, compared to group house rabbits. But you bring up a great point, is that you have a different population of rabbits that is difficult to compare to the pet community. And the reason for that is that the population of rabbits that you have, which is wonderful, are all intact, right? You don't have any sterilized animals in your
Actually,
facility.
I do.
Oh, okay, great. Yeah, but they
Yeah.
probably don't represent the biggest number, right? Is that
No.
you have mostly, yeah. So in pet rabbits, we see those individuals are usually sterilized between like 5, 6, 7 months of age. And so when that happens, there are two entirely different behavioral characteristics of sexually sterilized rabbits versus those that are intact. And so
The problem with
go
the
ahead.
gun paper, though, is that if you look at the gun paper, the rabbits in that study, I believe, were under senior age, under 6 months of age.
Yeah, because
So
they're
they
neotenized,
had
right?
asexual characteristics.
Right, so they're neotenized, which reflects sterilized rabbits. So if you're in the
Yes.
pet community and you're sterilizing them before puberty, which is what we do, then those neotenized rabbits reflects the rabbits that you're having in captivity, as opposed to those rabbits who have gone through puberty. And they've gone through puberty and have the hormone changes and the brain changes associated with puberty that happen there, those are the types of things that we see. Then after that, their characteristics are different, right? So that's why the pet community has different socialization needs than the breeder community, because the breeder community has a predominantly intact rabbits who have different hormones, who have different behaviors, etc. And then if you have sterilized rabbits, they're going to have neotenized behaviors if they're sterilized prior to puberty. So for male rabbits, that means prior to 5 months of age. We try and do them when they're 4 months. If for female rabbits, try to do like 6 months. And that doesn't catch
So
all of them, but that's when we try
yeah,
and do most of them. Yeah.
I would. Okay, so there was another thing. So the statistic on the cancer in rabbits,
Yeah.
that was
Yeah.
recently updated as well. The Green study that originally found that was from the 1940s, the 80% statistic everybody bats about. That was actually from the 1940s, early 50s with the Green study. The new studies coming out you're looking at maybe an 11% rate of specifically. Oh, Maddie's got it. Maddie, what you got?
For when it comes to your socialization study, Domino, are we talking about the social nature of European rabbits by Louis de Vinci in
Yes.
2016?
Yes.
All right,
Yeah.
perfect. And then
And then
also,
the
what?
statistic on that would be under cancer in the wiki.
Yeah. So the hard
You're
part.
cut out, Maddie.
No, you're good. I was also going to say, when it comes to the socialization, I think the biggest thing that we're disagreeing on is just a generalization of sterilization of when our hormones are setting in place and how these rabbits are interacting with each other. It is what seems to be the biggest differentiation.
Yeah.
And with the hormone, the other thing that I could argue with the sterilization of rabbits, before I get into the cancer topic,
Sure.
the sterilization of rabbits is one part of the puzzle with the rabbit social structure. You can spay and neuter, and that removes the hormone section.
Yeah.
But it doesn't. With the rabbit social structure itself, you still have two more points. You have where is my you can remove. I'm looking for my mate, and I'm protecting for my mate, and then you remove that part, but you still haven't removed the territorial drive, which is still there even if you spay or neuter, and you aren't removing the resource guarding, which rabbits do.
I would say that you do the resource guarding. Certainly, resource guarding is going to be a thing. You have to provide adequate amount of resources for multiple rabbits in the same space. That's absolutely true. As far as the territoriality goes, territorial defensiveness is sex steroid related. So it is associated with estrogen, with testosterone, and with androstenedione, so the precursor hormone associated with both estrogen and testosterone. So androstenedione levels are similarly associated with some of the behavioral characteristics that you're talking about. And so by sterilization, you remove that influence of the androstenedione that can cause territoriality, right? So that's one of those.
But the
Not
territoriality that I see has it shifts from the sex hormone expression to the resource guarding. It becomes part of the resource guarding.
sure,
So
and that's what I
it'll
mean is
shift.
yeah, it's not without management requirements. Yeah, you got to provide adequate resources that there's enough for everybody and that they aren't fighting over resources and things of that nature. I mean, because we can anecdotally say like, you have seen many cases of rabbits who fight over things. I obviously see things from a medical perspective because people bring me sick animals. So when they bring me sick animals from a production setting, they're usually doing stereotypic behaviors where they're like cage chewing and causing dental trauma. We have some oral injuries. We have over grooming, where they're grooming bald patches and things like that. So I see like some of those like stereotypic behavior type results. And
Mm-hmm.
in the pet rabbit community, I see the cancer. I see the cases of the individuals that are coming in with like trauma from resource guarding fights and things like that. So yeah, I definitely see anecdotally a lot of all of them because like I said, I see maybe 1,000 rabbits a year, from a medical perspective, and so
Yeah,
we
there's a massive dearth of information too. So a lot of
there
times you're stuck with the anecdotal report.
right.
To get into the cancer statistic, the Green study that was done in the 40s and 50s that came up with that 80% number that everybody bats around. That was specifically in a colony of rabbits that was bred for cancer research. And the new information that is coming out, you're looking at about 11% specifically uterine cancer. And in that, the majority of the rabbits that they're finding have endometrial hyperplasia. And what I don't understand is why in these studies they aren't taking into the fact that rabbits don't have an estrous cycle. So they
Sure.
keep their uterine lining thickened in constant readiness of impregnation.
Yeah.
So why in these studies it's not cancer? It is a thickening. It is a constant thickening of the lining, but it is not cancer. So why are they even including that in these studies? Even I know it is a precursor, but it is the natural state of the rabbit.
So those are two. Oh, sorry, Maddie. Go ahead.
Domino, are you quoting a review of mammary tumors in rabbits from 2019 from Sandra Skuntner?
It wouldn't be mammary tumors. I think it's uterine carcinoma. I think.
So I want to
Well,
Yeah,
which
it's
ones
kind
do
encourage
of.
I have under
you.
cancer?
So I want to encourage you to use this sort of large study. So larger studies are better, right? When you include more animals in
Yeah.
them. So this one includes over 2,000 animals. So it's a pretty good study. So this is called Neoplasia and Tumor-like Lesions in Pet Rabbits, retrospective analysis of cases between 1995 and 2019. And so it discusses,
The one that I'm quoting actually references that.
yeah. So the rate of cancer seen, and this is a great question. It really comes to the crux of this question over spaying or neutering. Um, is a cancer rate in this situation in female rabbits of 19%? Is that tolerable? Are you okay with that? If you're fine with a 19% cancer rate, then that's fine. You don't have to spay and neuter them. Then you just acknowledge that about
Yeah.
1 in 5 rabbits is going to get uterine cancer, and that's okay. If you, and actually in this study, that's all tumor types. So the uterine cancer might be 1 in 8, right? So even if it's one in
Mm-hmm.
eight, like, is that okay? Are you fine with that rate of cancer? If you're fine with that, then no problem. And if you think that that's too high, then you should spay. And that's all about, and this circles back to the amputation case that kind of started all of this. That
Mm-hmm.
is all about owner in being informed and about consent to the risks associated with surgery, and are the risk associated with surgery worth the decreased cancer rate? That you know that 1 out of 8 female rabbits or 1 out of 5 female rabbits is going to get cancer. And so rather than have your rabbit get cancer, you would rather have them go through my surgical complication rate, which is about 2% for rabbits. So about 1 in every 50 rabbits, we have a complication if we do surgery. So if that's your surgical complication.
Does that complication rate also include adrenal tumors?
So I'll say that I've never seen an adrenal tumor in a rabbit. See a lot of them in ferrets. Seen hundreds, thousands of them in ferrets, but I've never seen it in a rabbit.
There's more information coming out now where it's actually more prevalent in rabbits, and in fact, they've been starting to. There's a few case studies, and there's thinking that it's similar to ferrets. It's not as prevalent as ferrets.
So in this neoplasia review that was here in 2014 or 2000, over 2,000 rabbits, slightly over 2,000 rabbits, they had 4 cases of endocrine tumors, and 2 of them were adrenal. So in that review of a very large number of rabbits, the rate of adrenal cancer was quite low. But again, that's it's all about understanding the risk factor as an owner. You don't have to. Nobody's going to put a gun to your head and say spay your rabbit. I mean, you can do whatever you want to do. You just have to acknowledge that there's a risk factor for not doing that, and there's a risk factor for doing it. If you're that
She's
one
got
person,
the DOI. What's the DOI on this? DOI 10.1177.
Yeah, that's the Bertram study that I was quoting.
Okay, the Bertram. Okay. So the other thing with the spay and neuter, Dr. Whitehead, the doctor under the cancer thing, Dr. Whitehead has a quote there, Maddie.
Sure.
In the Bun Club wiki. Could you read that quote off from Dr. Whitehead?
Let me find it real quick.
You're going to search. Go to the wiki and search under cancer.
So I'm gonna circle back to a couple points I wanted to hit on a few other subjects that we were talking about while you're finding it.
Yeah. Go ahead while she's searching for that.
Yeah. So for me, all the medicine that I practice comes because like I said, I see however many 1,000 rabbits a year. Of the animals that I'm seeing in practice, the biggest thing that we have to focus on in the veterinary community is client education and in informed consent. I can't force anyone. I can't encourage anyone to do anything if I don't know the stats behind it. And I also can't feel like they are having informed consent unless I'm knowledgeable about the outcomes of these things. And so, like I said, I'm a referral center. I have 10 years of practice, of specialty practice, of doing exotic animals specifically, zoo animals specifically. And with that background, I have had the opportunity to see a lot of things and to learn a lot of things. And if I'm not giving that information to my owner, that means that they are they don't have the opportunity to make the best decision for their life situation. So in these sorts of situations, there are things that I can do to do my job better. So, for example, we intubate the rabbits that we do surgery on. We use a rigid endoscope with a size 2.7 millimeter scope head. We do an over the rigid endoscope intubation technique. We can breathe for them for the full surgery. We use an injectable protocol that's been shown to be safe compared to other injectable protocols as a pre-medication. We make sure that we monitor blood pressure. We have an ECG that's on them at all times. We have a capnograph that's on them at all times. They are treated just the same as a human that was undergoing anesthesia at that standpoint. We have emergency drugs on hand. We have epinephrine. We have atropine. And yes, they make atropinase, so that we also have glycopyrrolate. So we have specialty level care for those individuals to reduce risk. That's what I can do on my side. On
so
the owners,
when you were talking, I'm sorry, I hate to interrupt you, but on one of your videos, I saw you when you were intubating. You were going off of the breath steam up the tube,
Yeah,
And
that's for a really big rabbit. Yeah. Hmm.
that was for a really big rabbit. I
Yeah.
don't understand why you weren't visualizing while you were intubating.
Yeah, so blind intubation is not associated. There's a really good paper that's out there that shows that blind intubation is equally as effective as visualized intubation in rabbits above a certain body weight. So once they're above 2 kilograms, they're equally effective. There's not a difference in like tracheal trauma. There's not a difference in laryngeal problems, and then post-operatively, there's not a higher rate of like laryngeal injury that's associated with that. So because of that, in those clients that are financially limited, we offer the opportunity for blind intubation because on our side we use sterile endoscopy equipment, so we have to sterilize everything every time we use it, and so
So
there's a cost.
they're getting a sterile charge every time that they have to do
So
the.
because I got to run it through the autoclave and I have to use my packing
Yeah.
materials and all that kind of stuff, so it every time I intubate a rabbit with a rigid endoscope, it costs me about $100. So then that obviously is something that that is relayed to the client. Now it makes it's safer for the rabbit,
So
but it takes.
the blind intubation. Blind intubation is a more of a cost saving feature for the clinic.
It's a cost-saving feature, but I don't offer it in small rabbits because it has a complication rate associated with small rabbits. So if your rabbit is too small, and if blind intubation makes it so it's a riskier procedure, we don't do it. I don't offer anything that's going to increase the risk for the outcomes
So
for the
basically,
procedure.
rabbits that get up to like Yorkshire Terrier size and up, those
Yeah,
are the ones that you can do a blind on.
right. Yeah, exactly. Yeah, so we have to give people the ability to have exceptional level care if that's what they're willing to pursue for their pet. And so like I for those pet rabbits, I bought a $25,000 endoscopy equipment to be able to just
Mm-hmm.
intubate them because that's necessary for those people to get the care level that they want. I needed to get an endoscope that I could intubate them with.
Yeah,
So that's it.
definitely. I understand
Yeah.
that you're in every clinic. It's always when can we get the newest latest gear, because that's
Right.
just the way it works. My other question was, in one of your videos,
Mhm.
I see that you go to pull on you do your pulls on the lateral saph with the
Yeah.
rabbit on its side. Um,
Mhm.
why why are we choosing the lateral saph when it's a little calmer and easier on the rabbit to do a marginal?
So marginal ear vein draws are perfectly fine in certain size of rabbits once they're large enough. You can cause embolism of the vessel if they traumatize it. So like if you get a head shake or anything like that, you can accidentally lacerate that marginal ear vein and cause an
Yes.
embolus that causes edema to the ear tip. So you basically obstruct the marginal vein. When you obstruct the
So
marginal vein, you have a buildup of fluid in the tip of the ear, and then that edema that builds up from trauma to it can cause complications. So we try the
complications.
lateral
Yeah. Okay,
saphenous
I got
first.
you.
Yeah, we try the
I
lateral
got you.
saphenous is associated with a lower complication rate, so that's why we use it. So yeah.
Okay. All right. So basically, it's a size thing.
Yeah, and in big rabbits, it doesn't matter. You could do a marginal ear vein. You're less likely to cause a significant amount of trauma associated with that. And so when I'm working with rabbits, because of the field that I work in, I work with a lot of really, really tiny bunnies. And so when I'm working with those really tiny bunnies, it's important that I have the ability to collect samples that don't cause their own problems. So
Yeah, I understand. I understand the actual mechanics there. I have
yeah.
an English law Flemish giant mix that I
Oh,
actually use to teach blood draws on the marginal
sure,
with
sure.
other techs, because he's got those big, fat, happy veins in his ears.
Yeah,
So
yeah.
I didn't understand, because the rabbit didn't seem that small to me. It might be a camera thing, because I know on TikTok it makes everything look different.
Yeah. So
Um,
I have a bigger size limit as far as the size of rabbit, and I probably could do it on smaller ones, but I have a bigger size limit because I know my skill set. But the majority of the time, if I'm having blood drawn in my clinic, it's my technicians that are doing it. So
uh,
for to make sure that they are very safe with their draw, anything that's 2 kilos, so a 5 pound rabbit, basically four and a
yeah.
half pound rabbit, or smaller, we will do a lateral saphenous. Anything that's larger than that, we can do a marginal ear, but my staff has become so comfortable and so fast with that lat saph that they usually draw from there. So,
Okay. And that was something that I was like, what? Why are they pulling? I just, I don't see it that often, so
yeah,
I didn't know why we were going for lat saph.
yeah,
So
yeah,
that was another thing that I saw. Oh, with the coat types, I noticed that you made a few little errors in the coat types.
yeah,
Okay, so in your video it says guide hairs. It should be guard hairs.
yeah.
And
I hope that was a
wool.
spelling mistake.
Yeah, and it says guide
Yeah,
in the captions. So you have your undercoat, and
yeah,
then you have your guard hairs. In
yeah,
a Rex coat is all undercoat with a minuscule amount of guard hair,
yeah.
and then
So,
a wool coat is totally different.
yeah, yeah, yeah. So I think it's industry differences as far as like how our terminology, how we refer to things. So the undercoat in the medical community is commonly referred to as a wool coat or as a thermal coat because of what its functional purpose essentially. So that I think hopefully is the industry difference. The guide hairs versus guard hairs, that is a spelling mistake that I made. So thank you for calling me out on that. I should find a place to correct that somehow. But yeah, so you can tell me if I'm wrong. I used to raise mini Rex rabbits, but correct me if I've got an error here. They definitely have a more sparse guard hair density than some of the other species do, or some of the other breeds do, excuse me. But the primary reason that their fur coat is so different visually and texture wise is because the guard hair length and the wool hair length, well, why I would call the wool hair length, you would call the undercoat length, are the same. The length of them is equal in length. And because of
Hmm.
that, it also makes them significantly more predisposed to pododermatitis, by the way. So because they
Yes,
don't
because they
have
don't have the
as,
guard hairs to guard the feet.
yeah,
Yes,
yeah, exactly. Yep.
I raise Rex. I raise Rex, which is a 10-pound Rex
Yeah.
coated animal, so that is a major concern.
Yeah. Yeah. No, it's great. Did we want to,
But yeah,
I've got some paperwork to do tonight, so I've only got about 20 minutes left. So I
okay.
apologize for that.
Oh no,
But I
you're good.
didn't know if you wanted to circle back to the amputation case for a
Yes.
little bit, just because I think there's some good points to discuss there.
Yeah. So as far as the amputation goes,
Mhm.
it is still my opinion that given the fact that there are so many complications that are going to happen after this surgery, we're trusting a lot in the skill and compliance of the client. We are, and the other thing is the client, going to client compliance. Is the client going to admit that we've hit the end?
Yeah.
And that is the hardest thing for a client to do, even if they're 100% compliant across the board. Telling them to let go is the one thing where they'll stick, and
Yeah.
that's that 1% non-compliance is
Yeah.
getting them to the point where they realize it's the end and they need to let
Yeah.
go, because that is the problem that I see constantly in
Hmm.
the groups, in social media, is they will, I just case in point, one of these rescue groups that purports this, or what is it, spreads this keep them alive at all cost mentality,
Hmm.
kept a quadriplegic rabbit alive on its side for 6 years.
Yeah. That's abuse. I mean, we can all agree on that, right? So that's not, that rabbit is not able to experience the a quality of life that's necessary. So that's such a wonderful point, and I really appreciate you bringing that up, because the difference is that we all know there's a limit, right? We understand that there's a limit of where it's okay to do things, and so really on our scale, you and I don't disagree. Oh, sorry. You and I don't disagree that much. Um, we just are where the line's at, right? And so, like you would say, if a rabbit had a broken leg and I could fix the broken leg, that's okay, right? And so,
It depends on how much the leg is going to be coming off. It depends on how much of the bone loss it's going to have, because we all know that, you have a higher instance
sure,
of
sure.
infection over a
So,
certain amount.
so assuming good quality care that follows up and allows them to have a high quality of life afterwards, if I had a broken tibia and I put a plate on it and they healed the leg and then I just let them run around for the rest of their life and they didn't know any different that they had a plate on their leg, we would all be okay with that, I think. The
Yeah, as long as the rabbit's not in pain and able to express itself.
Right, exactly. And so for that's a sliding scale where we're all not okay with a rabbit that's quadriplegic getting force fed. None of us are okay with that. And so that is where we say, okay, where's the line in between? And so this is my perspective as a veterinarian that sees, I don't even know how many tens of thousands of cases in my career. I can't force any client to do the right thing, but I can set up a scaffold. I can set up a system that gives them the opportunity to be successful. So I can make a follow-up schedule where they have to come in for recheck appointments. And if they don't, then I'm calling them, I'm bothering them, saying like, where's your animal at? Bring them in here. You need to check with me or with your referring veterinarian. I need you, blah, 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 right? I can set up a system where they're getting reinforcement from us, from my practice to say, we need to check to make sure this is going well still, because I have an obligation to that animal. At the same time, I can give them the tools to be successful. So I can teach them how to do things like look at a grimace scale. I can teach them how to do things like to look at feed intake and fecal output and look at weight bearing on the limbs and to look at mobility factors and all these other things that we look at to look at stress levels in rabbits. We have 4 or 5 different very good scales looking at stress in rabbits, and you can look at all of them at the same time, right? So that is my responsibility on the veterinary standpoint. And so the question I think that is really hard from a vet is, when do I say that I'm not going to give that owner a chance to be successful? So at some point I have to say, no, this rabbit could have a good outcome, but I'm going to refuse to give that opportunity because I don't trust this person to do a good job. And my hard part with that is that that's a really tough call to make. That's me judging a person. That's not what I'm trained to do. I'm not a psychic. I'm not a sociologist. I'm a vet. And so for me to say, I don't trust you to do this for this rabbit, so I'm not going to give this rabbit the best medical care that I can provide, is a hard sell. But I can give the owner education. I can give the rabbit the best medical care that it can possibly get. I can set up a system in place that's going to lead to the highest chances of success. But I can't control for every single variable. And so the owners, euthanasia is never the wrong choice. And we talk about it extensively, where I'm like, this is going to take a lot of work. This is going to take a ton of work. There could be complications that you don't want to face down the road, and you're going to spend, and I know there's questions about how much it costs, $800. You're going to have spent $800 on a surgery that you need to euthanize in 3 days because the outcomes aren't good. And that is one of those things where you potentially are just, you have to trust that owner to some degree. I don't trust them with a lot of things, but you have to trust them to some degree because it is their possession. Their pet is their belonging. And so I just have to give them the best chance I can to be successful, and to do what's in that animal's best interest, which in my opinion is to give it a chance at a high quality of life as long as the owner follows through. And I can't sit there and hold a gun to their head. So
yeah, see, and then I think that's where we differ at. I think that because of the managing the fallout from a surgery like this, it is my view that the quality of life is greatly reduced for the animal, because of the continuation of these other issues that arise post amputation. So
Sure.
for me, it takes it
So
down. The QOL scale just drops when
sure.
I know for a fact that post amputation, this animal is going to have arthritis. This animal might have the incision site get infected or reopen. This animal might have bladder issues. The QOL scale just bottoms for me when I know the outcome is a really high likelihood of some poor things happening.
Yeah. And that's the risk factor for complications is one of the things that you have to be transparent with the client. You have to be transparent with them and say, yeah, there's a 60% complication rate with this. And I did want to point out earlier that when you talked about that 81% complication rate that's associated with it, that's morbidity and mortality. So that's fatalities and morbidities. The morbidity rate is more like about 50%. It's 50 something percent. I don't have the paper right in front of me. Sorry, my phone
59.
died. 50,
It was
yeah,
59.
59%. And so that includes things like a suture, like popping a stitch, right?
Adhesion.
A dehiscence, right? So those things are relatively minor complications where it's like, you popped the stitch, we're going to put a new stitch in, you're fine, you know? So those things that's included in that number, but there are major complications. So, a morbidity and a mortality. A mortality means that animal dies. A morbidity means that there is something that is a negative outcome associated with it, but it doesn't scale the outcome. So as little as like a sore foot, like a pododermatitis that develops, is rated the exact same in a morbidity study as like rolling, unable to right itself, laterally
Did you know?
recumbent, horrible
Did you know
outcomes.
there's an actual cottage industry specifically to make socks for amputated rabbits because they get
I did
pododermatitis so bad?
I didn't know that.
Yeah.
So in this specific case, the reason that we chose to do two separate or both legs. Number one, the other
The
leg was
bilateral.
so
Yeah,
yeah,
to do the
severe.
bilateral.
Yeah, the other leg was so severely affected it needed to go anyway. But I in a bilateral amputation, if I can make the sling and the cart light, very light, but stable, if I can put him in a secure padding that supports enough of his chest and belly, and I don't like a lot of the carts that are out there. If you go look at a lot of them, they are horrible carts because they don't meet their biometric needs. And if you look at the biometrics of a rabbit, their forelimbs are meant for pushing forward, but they are not. The rear limbs, once you amputate at the prefemoral, and so at the coxofemoral
Their
or
powerhouse
the
is gone. Yeah.
right. So the strength, they're not hopping animals if you change the conformation of their hips, right? And so you have to make it so that they're in a normal conformation from their biometrics. So for those, I'm getting a little bit off track there, but the main thing that you need to take into account is that I have to take into account the length of the animal, the height of their legs. I have to measure all of these distances and build a cart that specifically matches the biometrics of that animal so that it has the appropriate amount of biomechanic force on the ground when it's moving. And so you have to measure each detail of the head and the neck and the body to build these carts. And so these ones you get online that are like pre-made, they're just not the way to go. They have to be custom made for each individual.
Yeah. And unfortunately, a lot of times you're seeing these homemade jobs out of PVC pipe that are not measured
Yeah.
to the rabbit at all.
And that's right. And so like PVC pipe is a good cart system because it's lightweight, it's easy to move around, it is very stable, but it has to be specifically measured to that rabbit. You can't just build something and hope they fit to it. It has to be built specifically to their conformation. And so it's different goals for companion pets versus like breeding as far as that goes. But that doesn't mean that we have a different level of love and a different level of compassion for the animals, because I know that you do. And I think that you get accused a lot of times of not caring about your animals. And I know that's a lie. And I know it's not true
Yes.
for all of you. You do care about them. You just have a different perspective as far as their medical care, and that's fine. That's and I'm not here to criticize anyone about that. For me, it's just for these owners who have one rabbit and want to invest, because I warned them over the course of the care of this rabbit, not just with me, but with the extra care and needs that he has, because you're going to have to replace the cart regularly. You're going to have to do those kinds of things. You're looking at like a $2,500 to $3,500 investment over the lifetime of this rabbit. Even though my surgery is $800, you're still going to have follow-up care and you're going to need all those kinds of things. Though all of that side of it, you have to know up front that that's going to happen and agree to that, and they are on board, and that's one of those things I think is really important.
I gotta say the name of this rabbit, and somebody in the comments commented, is the owner of Skittish Shitsalot the unicorn?
They are for sure. They're hilarious. They are, and I don't know if they would care that I say this. They're privately, independently wealthy. They are interested in doing the follow-up care. They work from home, so they're available with the rabbit all the time. Skittish Shitsalot is is honestly super, super well cared for as far as like the diet is immaculate. They are able to do like the setup for it. It has a series of rooms that are his rooms. So instead of having like a single cage, they have multiple rooms that are his rooms. So the rabbit is in a situation where he has a good opportunity for success, and they're aware that things don't always work out, but he has the ability to be a successful rabbit in this situation.
Okay. So Maddie, do you have anything to add, or you've been quiet for a while?
I've just been taking it all in, and I also had that one study pulled up. But I think and this is from a layman's perspective of just knowing what I know, but coming at it from a perspective of just understanding basic vet terms, but not going real deep into it. What I am understanding is for something like this to be successful, for something like this to be ethical in nature, we have to have a unicorn of a client, and it has to be very specific to the rabbit when it comes to size, when it comes to diet, when it comes to aftercare, for it to be successful, for it to be an outlier from that 85% mortality and morbidity when it comes to studies. Is that fair to say?
Yeah, I would say that this surgery, if presented to me from clients, now I recruit a very specific client base. I have clients that come to me specifically because they know that they're getting a very advanced level of medical care, and I see a different selection of animals that most vets won't see or don't have the experience to see. I would say that of all the clients that come through my door, it might be 1 out of 50 that's a good fit for a surgery like this, as far as like the necessary post-op follow care. And again, that doesn't guarantee good outcomes, but I think that in this rabbit, we may have some more morbidity, right? I'm not going to guarantee that there's no morbidity, but this is the other point I want to make on that, is a short good life still worth the short duration of time? So for this owner, $800 is nothing. They don't care. So in that sense, if this rabbit can have a year and a half of very high quality life, and then a year and a half from now starts to develop some elbow arthritis that diminishes his quality of life and decreases his mobility further, at that standpoint, then is that year and a half not enough? And so that's the question that I think is really hard, and I don't have a good answer to it. I don't know that anybody has a good answer to that question, but it's the one that we have to ask ourselves, because a lot of these surgeries we're talking about, is it something where the success of the surgery, if it only gives 6 months, is it still worth it? What if it only gives 3 months? Is it still worth it? Those sorts of situations are tough questions to ask. We have to ask that about tons of different cases. You have to ask it about, giving dogs chemo, where you're like, the average survival time after chemo is 90 days. Is it still worth it in that situation? We talk about it in like chronic kidney disease in cats, where we know it's a chronic disease that's not going to get better. What if I only give them a month? That is a question that's very personal, And that's a question that's very intimate to each human owner. And so I don't know that I am the right person to answer that question. But as far as from the vet's perspective, if I can at least make the remainder of his life, however long that might be, as good as possible, that's my goal.
Yeah, and that's our main concern is the quality of life, and being able to put the foot down when that quality of life drops below an acceptable threshold.
Sure.
Because we see it far, and I know it's anecdotally, but we see it every day because our group interacts with these people every day.
Yeah.
So,
and I think that those are cases where there are people where they pursue care for an animal that they're not equipped to have in the first place. You know what I mean? That's in those sort of situations, it's the problem starts by when they acquire the animal more than when the animal gets an injury or gets a disease, you know? And so I think a lot of that, and I appreciate what you have said, is that a lot of times you don't sell to pet owners anymore, you sell to other people because you don't want to be responsible for letting someone that is not an appropriate pet owner, that can't provide appropriate care. You don't want to be the person who's responsible for them being in the care of a rabbit that they're not going to take care of. And so, you know, that's in those situations, I think that is a person, if they're a person who will leave a rabbit on its side for 6 years and force feed it that whole time, they never should have had a rabbit to start with, no matter what. That's a person who is not suitable to be owning a pet. And so that I think is the problem comes that we need to educate people about whether or not they need to have animals or not. Because I get a lot of people that ask me if they should get pets, and I tell a ton of people no, that you do not need a pet. That is 90% of the conversations I have is telling people not to get pets because they are wanting animals that they're not equipped to take care of. So
that's actually a really good answer. And that's part of the reason. That's part of the reason that we do our best to keep our stock out of the hands of people that we know are not going to follow through in the best interests of the animal. Mm-hmm. It is better for them to not leave the barn alive than it is for them to go out there and experience some level of torture and a horrible quality of life.
Yep. And I have a genuine question, and this is not because I genuinely believe that it is important to and sorry, I do need to go here in just a moment. But it's important. Sorry, I just totally lost track of where I was at with that comment. As far as culling, I have a genuine question about culling, and so I have no problem with it. I fully support it. I think it's important to do, and so sometimes they get to adulthood and they happen to end up with a unicorn family, but that's the rarity. The better thing to do is to do right. So I have no problems with it at all. What technique do most people use to cull rabbits in home care?
Cervical dislocation.
Okay. I think that's wonderful. That's great.
Yeah, it's an AVMA approved technique. We do it a couple of ways. We do it, there's a device called a hopper popper, which is actually mounted on a wall. That's a downward pull. Or you can put a bar across the back of the neck and upward pull, standing on the bar. Yep. Or some people, it's called a choke chain method, where you have them, you put them in the chain and you're pulling down on the chain. So it goes around their neck and you're yanking down at the same time. So it has the same effect as the hopper popper does. But you have to have a fast enough technique to do it. It's not for beginners. Or the traditional neck wringing. Yeah.
So cervical dislocation is the appropriate way to do that. And I thoroughly support that. I have seen a few where they do it by just a starvation method because they don't want to do that, so they throw them out in the pasture and the field and stuff like that.
Oh my God, no!
So that is an area of criticism that I think there's
absolutely not.
There's people that do bad things, and that does not reflect the community, and I know that. But I think it's important that as a group we promote cervical dislocation.
Yeah,
rather
cervical
than,
dislocation is
yeah,
absolutely what the majority of us use. Yeah,
yeah,
under three, we actually, a lot of us are so skilled that we have heart cessation. The heart's gone before we even get them out from under the stick.
yeah. And I think that's great.
So,
That's so the
yeah,
cervical dislocation is a very humane method of euthanasia, and that's perfectly fine. And I think it's very commonly done. The two methods that I have multiple breeders have gotten in trouble for in the Midwest is for this the starvation where they just chuck them out and then leave them out in the wild because they think
oh
some
no,
fox or something's going to get them. And then the other is the neck wringing, but that's not an effective, quick method where they
yeah.
break their neck, but they don't actually cervically dislocate
You're
the
talking
skull.
about the pipe hit, the pipe hit method.
Well,
There,
the ones so that's also not ethical, and that the cervical dislocation method that you use is the
yeah.
correct way to do it. But the one that I'm talking about that got a guy in trouble pretty recently in a nearby area to me was that they just break the neck without actually cervically dislocating the animal. So they haven't separated the brain from the spinal cord. They just
Oh
disrupt the
no.
spinal
Okay.
cord. And so by disrupting the spinal cord, when you break the neck without dislocating the head, it causes paralysis of the respiratory muscles because it's paralysis and they die from that, but they basically suffocate. And it's just
It's hypoxia.
yeah.
Yeah.
So
See,
cervical
with our
dislocation is the way to
method,
go. Yeah.
with our method of cervical dislocation, we're pulling hard enough that we're not only cervical dislocating, we're also rupturing both the arteries and the veins.
Yeah. Yeah.
So
Yeah.
we're
Yeah.
having internal bleeding on the inside of the neck as well. So they're
Yeah.
bleeding out and they're cervically dislocated at the same time.
Yeah. Yeah. That's
I
very
say,
ethical.
and
Yeah.
in most cases, when I'm doing broomstick method, especially on the young ones, you do it so hard that it decapitates them. So
Decapitates
it's
them.
Yeah. That's very ethical. That's the way that you should be doing it. Yeah, that's the I think part of the because I think that the breeder community gets way too much criticism, and there are way too many people who think that you're out for money and those kinds of things. I'm sure you get those comments all the time. I know I get
We
those
don't
comments
get
all the
no
time.
money. Yeah, we don't
Yeah,
get no money. That's a farce.
exactly. And so
I spend way too much money on feed for that.
exactly. Exactly. So I think that that's an unfair criticism that's leveled both against some vets. I hope that I fall in that category, and also
Hmm.
against people who are breeding. Is that they're doing it for the money, and I think that in general the we're all doing ethical things. It's just a matter of being able to effectively communicate that. And so that's one of the big ones is like the culling technique. As long as it's done like with cervical dislocation and other humane methods, it's hard to talk about, but I think we do need to talk about like, look, we're doing this the same way that like vets do it. We're doing it the same way
Hmm.
that you do in a research lab. We do. It's not that you're doing something gross at home. You're doing a very ethical, very clean, very safe procedure that I think that more people should support. But anyway, that's getting off the rail just a little bit. But yeah.
The method that really disturbs me the most is gassing.
Yeah, like so. Do you CO2 gas method? You mean?
Yeah, the CO2 gas
Mhm.
method. I've only seen it in action twice, and both times were absolutely horrifying to me
Hmm. Yeah, I'm not a
because they're
fan of
going
it.
into hypoxia, and yeah, it's bad.
Yeah. Well, we when we euthanize in a clinic, what we do is we give them an over sedative first. It's a 2-shot protocol. We give them a sedative.
Hmm.
It's a combination of a muscle relaxer and a well, so it's a muscle relaxer and a dissociative agent, but basically it makes it so that they're unaware of their outside surroundings. And then we give them an overdose of pentobarbital, which is a pain medication. So it's a 3-drug protocol, one that's a sedative, so they're not aware of the outside surroundings, and then we give them an overdose of the medication. So
See,
yeah,
in my clinic, we did a 3 med. It was propo, morphine, and then the pento.
yeah, yeah, perfect. Yeah. So I think this has been great. I think I appreciate you guys being open to discussion and everything. I think we agree on the vast majority of things, far more than we disagree on. And so, yeah, the main thing. I mean, we're all pushing to do a better job all the time. I'm going to be publishing my study on the best way to like image rabbit skulls to look at their nasolacrimal ducts in the next a couple, hopefully in the next 6 months, but we'll see. But yeah, and then that'll evolve into more stuff that we just try and make the lives better for rabbits. So yeah,
Yeah. And speaking of making lives better for rabbits,
yeah,
one quick thing before you leave. I
yeah,
would like you to look up the use of tulathromycin, which is Draxxin. It's used in livestock vet
yeah,
a lot. We have privately been using it amongst the breeder community, not only here in the U.S., but in New Zealand, with massive results on complete elimination of P. multicida.
yeah, yeah.
Complete elimination. I'm talking histopathology, blood. The Draxxin is knocking it out. It
Yeah. So
is.
Carpenter, so I work with Dr. Jim Carpenter. So he and I actually
I
share an
have his
office where.
formulary. Yep.
Oh, okay, yeah. So I was Carpenter's work study student for years, and then he's a mentor of mine, and now we share an office wall, and I sit in it and we talk all day long every day. He's a very, very nice man. He needs to retire because he's
Been
worked seven
doing it
days a
for
week for
years.
45 years. But
Yep.
so anyway, so love the man to death. But he and I have been talking about a PK study using tulathromycin for the treatment of rhinitis and sinusitis caused by Pasteurella multocida. The hard part was getting the drug company to support it because of the drug withdrawals. And so the concern being that if you use it in breeders, the time to withdrawal period and developing a withdrawal time period is a little bit challenging. And so the concern amongst like food and health safety officials is whether
Is the
or
withdrawal
not
times too long?
people will adhere to the withdrawal times. And so to allow us to do a study where we talk about the pharmacokinetics and the pharmacodynamics in a rabbit model of rhinitis and sinusitis, we have to get the food and drug officials to say it's okay to evaluate those sorts of things. So that's one of those things where it's probably a ways down the road to get those sorts of approvals, but it's definitely in discussion within the vet community. So tulathromycin is a great drug for a lot of different purposes. And I think it's down the road. It's on the horizon for a few different people. I think one of the people who also is going to look at it is Miranda Sadar. She does a lot of PK
Mm-hmm.
studies. She's at Colorado State. But yeah, she's a wonderful woman, incredibly intelligent. And
CSU
she also
Colorado State or which or CU Boulder?
she is at CU Colorado State. Yeah, CSU at the vet school there. Yeah, yeah. So, yeah, but it's good stuff. It's we're working on it. So, yeah, and I'll
All
let that
right.
be
Well,
my
this has
cue
been
that I got to
I'm
go.
sorry, my
Yeah,
son's calling me.
that's fine.
But this has been an absolutely wonderful discussion.
Yes.
Yeah,
Thank you.
But
Thank you so
if you
much.
ever need study rabbits for a Draxon study, hit us up. We have
yeah,
plenty of
Thousands for
available
ya.
subjects. Yeah, we got
perfect,
subjects for you.
perfect. All right, you guys have a good one. I appreciate the candor, and we'll talk again soon, I'm sure. So,
All
Oh,
right.
definitely.
Thank you
Thank
so
you so
much,
much.
thank,
Doctor.
yep, take it easy. Yep.
Bye
Night,
bye.
Doc.
I gotta run.
Yeah, no worries. Thank you for chilling with us. I'm gonna close it out here if you need to go answer your phone.
Yeah.
All right, y'all. That was tonight's live. It was definitely very interesting. I really did enjoy it. I have a lot of notes to kind of go over. I'm going to be posting kind of my viewpoint on everything and all the notes that I have after we kind of go over it. But thank y'all so much for hanging out. It was definitely a good one. I appreciate y'all answering the polls and everything, and it's been a good one. And my brain is happily fried. So happily fried. Yes, Vesp, that is amazing. I loved this debate. It was respectful, it was beautiful, it was glorious. Um I loved the conversation all around, and it just shows we can all have a difference of opinion. And it was, I loved this for a debate. I agree with everyone. This live was so nice. Um, maybe we'll have to get Doc on here again, and we'll have another little controversial viewpoint because he was right. The conversation was it was glorious. I have a lot of notes to go over, but again, thank y'all so much for hanging out with me. Next time, I'll get this box situation figured out. So my blood pressure is low, my skin is glowing, beautiful, and my is malocclusion next time. Ooh, that's a good one. I do love nice civil debates. We'll have to discuss what the next one will be, and maybe Doc will come on again because it was good. Because I don't think I necessarily, from a general viewpoint, I don't really move from my standpoint. But when we are talking from his unicorn patient, I can definitely see where he's coming from. And there was beautiful, beautiful conversation. But I gotta get the babies to bed. I gotta get myself to bed. I haven't had dinner. Thank y'all so much for hanging out, y'all for including. It's been glorious, and I'll see y'all in the next one. Bye, guys. Awkward exit.